This is also.
I've been thinking about this for a month.
It's like my first meeting as superintendent. Evelyn.
I will call us to order. Thank you very much. Welcome to everybody and welcome to Open Session. If I could ask everybody to stand for just one moment and join us in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now I'm proud to turn it over to Ms. Lopez.
All right. So I'm going to handle the board elections, and first we will open the floor for nominations for the offices of chair and vice chair of the Henderson County Board of Education. The board will vote on nominations in the order received until a candidate receives a majority of votes. We'll conduct the election of chair first and then proceed to the election of vice chair. So with regard to the election of chair, the floor is now open for nominations. Do I hear any nominations?
I would like to nominate Blair Craven for chair.
All right, we have a nomination for Blair Craven. Are there any other nominations? Hearing no other nominations, I hereby close the floor and we will now proceed to vote. All those in favor of Blair Craven as chair, please, by roll call vote, state your vote. Start with Ms. Case.
Yes.
Ms. Holt, yes.
Yes.
Stacey Kasky, yes. Mr. Egoff?
Yes.
All right, that was a majority of votes, a unanimous vote in favor of Mr. Craven. Congratulations,
Thank you.
Mr. Craven.
Thank you.
Moving on to the election of vice chair. Are there any nominations for the position of vice chair?
I would like to nominate Ms. Amy Lynn Holt for vice chair.
All right, we have the nomination of Amy Lynn Holt for vice chair. Are there any other nominations?
I would like to nominate Kathy Revis for vice chair. Okay.
Gotcha. All right. We had a nomination that was declined by Ms. Revis. Are there any other nominations for vice chair? Hearing no other nominations, I will now close the floor and we will proceed to vote. All those in favor of Amy Lynn Holt for vice chair, please indicate so by saying your name and your vote. Starting with Ms. Case.
Ms. Case, yes.
Ms. Holt, yes.
Blair Craven, yes.
Ms. Kasky, no.
Mr. Egoff?
Yes.
Okay, by a vote of 6-1, that nomination has passed. Congratulations, Ms. Holt.
Thank you.
All right. Having concluded the election of officers, I return the floor, I guess, to Mr. Craven.
Thank you very much, and I appreciate it, and thank you everybody for thinking of me. Dr. Bryant, we have to work on that gavel, man. We have to hit that thing next time. So next year, shoot that thing bang.
Yes, sir. Absolutely. I'll practice for the next 364 days.
Please do so.
Hey, we can let you take it home and practice with Mrs. Bryant.
Yes, Kathy. Uh-oh.
He won't be here, but.
All right. So next up is the agenda approval. Now, we are going to move some things around in the agenda. Just one thing. We are going to take the return from learn update down in the board superintendent reports, and we're going to put that right after consent agenda. Mr. Smith has so graciously decided to come and join us for our return to learn update, and I think we need to get that going as soon as possible. So with that noted change, I will take a motion to approve the agenda.
I move we approve the agenda as presented with the change of moving return to learn up.
Do I have a second?
I second.
Ms. Kasky, all right. Ms. Case, is that a yes or no?
Ms. Case, yes.
Ms. Holt?
Yes.
Ms. Kasky? Mr. Bridges?
Yes.
Dr. Revis? Mr. Egoff?
Yes, sir.
And I'm a yes as well. The agenda has changed. Next up is board chair observations. So I have a lot of observations, and I've been thinking about this for a while, and I want to really thank a lot of folks today. My family experienced a terrible tragedy the week before Thanksgiving, and we lost a family member. And I want to thank everyone that's reached out and sent me kind words and flowers and everything else. He was a student of East Henderson High School. His name's Tony Case, football team. And so I really want to thank everyone that's reached out to me during this really extremely difficult time. Next is the HMS family, the Hendersonville Middle School family. We had a crazy event happen that everyone's aware of, a shooting where a student came to school with a gun and shot a young lady in the leg. And it's a school my son goes to school at. He was not there that day. It was his day. It was B day, so he was home with me. And I could not be more proud of our administrative team, the staff that handled that at Hendersonville Middle School, Mr. Gunnan and Mr. Garden, the SROs at Hendersonville Elementary and Hendersonville Middle that responded within seconds to that event, the sheriff's office, Laurel Park, EMS, fire, Hendersonville City, the SBI, everybody that has responded to that incident, it was top notch. This might sound weird, but we've planned for things like this for the last several years since I've been on this board, but you never expect it to happen in your little hometown, in Hendersonville. That could never happen, but it happened. It happened. But I could not be more proud of what you guys accomplished, and really thank you for your leadership and really bringing that whole team together. My son went to school that Monday. We had a lot more presence at school then. Teachers talked about it. We had crisis folks on staff. And my son said it was one of the most awesome days he's ever had at school. Everybody just came together and was, nobody felt unsafe that I've heard from about that incident at that particular time. So thank you so much. We will be looking further into what we can do as a board to make sure that we keep all of our kids safe. But thank you very much. So that's all I've got for today, and I'll turn it over to board members for their observation. Ms. Case, do you have any?
I don't think we got a digital. We had 156 teachers, 20 schools out of 23 were represented by a teacher or more. And I really think we need to read that letter.
I've got it.
You got it? Okay. Well, I just want to be sure that gets on there. And
Yeah, I'll share that at public comments right after this. I'm going to read all the digital public comments that we received because we're not having folks in the audience to actually give us their comments in person.
So I have a couple. One would obviously be the Hendersonville Middle situation. I am so proud of our officers and the staff that wrapped their arms around the children there. It was interesting going by the Monday after Thanksgiving, and Mr. Fender was out there, Mr. Sosha was out there. I mean, and when you think he's technology and Bernie's finance, but they were out there wanting to welcome those kids. And of course, with, Mr. Bryant, and I think Mr. Rhodes was out there with you too. Just welcoming them in and, making sure they knew that our district leaders cared about them. And then I can remember the next day going by, and I know Dr. King was one of the people that were out there, and I'm thinking of all the days it's this cold and they're outside, because that was a really cold day. You've got to be dedicated to kids to do that. And just it was really a top-notch situation. the way that our SROs and area fire departments and the EMS and just, I mean, everybody that could have been there was there. And I know that our teachers, they've all been dealing with a lot, and those families as well. And one of the reasons why I want to talk about it is I've had several people in the community stop me and say, you know, there was that announcement that there was a shooting and nothing. You guys have said nothing afterwards. You know, when are we going to find out what happened? And I was like, well, it's an ongoing investigation. We can't say, and you know, the police are going to take the lead on that when things can be discussed. So I didn't want to think that we're withholding information on things that might have happened. It's just information that we don't know, that when the police get done with their investigations and if and when we're allowed to talk about it, we can issue some statements then. But you know, we definitely are not trying to just act like it did not happen. And then my next thing would be, I want to talk about the amazing staff that we have at every one of our schools. And we have so many teachers that are out being quarantined for whatever reason and having to take COVID tests. And the teachers that are giving up their lunch period, well, they don't really get a lunch, I guess their planning period, to go into another classroom so that that class can be covered because we don't have enough subs to go around. And that would mean that they don't have time to collaborate and to write lesson plans and grade papers. And they're taking it home anyway. They always do. But everybody has just been so great with the amount of support that they're giving each other. And it really, looking at it from an outside direction in, it's a huge thing, and I didn't want this to go by without saying thank you to those staff members and those teachers and all the work that they're putting in so that we can keep our kids in school.
Thank you, Ms. Hunt.
Mhm.
Thank you.
I think we'll be covering it in the public comments.
Okay, great. Ms. Bridges, Dr. Rivers, Jay, or Mr. Egoff? You with us, Jay?
I'm good.
All right. We're going to be moving on. Next are going to be public comments. So today, like I just said, we're going to read these public, the submissions that we received online. I've given every board member to read one or two. I think I've got the two. And I'll go ahead and start. This is from Eric Claunch. The subject is the case for keeping schools open. Thank you for your noble service to Henderson County. I'm contacting you today to express concern about what seems to be North Carolina Governor Cooper's push to renew lockdowns and the dangerous effects renewed lockdowns will have on the Henderson County community, especially the children and family whom you are charged to serve. In a recent publication titled The Great Barrington Declaration, authored by Dr. Sunetra Gupta of Oxford University, Dr. Martin Koldorf of Harvard University, and Dr. I don't even know how to say that name, Bachara of Stanford University, epidemiologists from different backgrounds and from different political perspectives, all concluded that widespread lockdown policies are a devastating public health mistake. An excerpt from their publication reads, all children have a right to a high-quality education. Adults have a moral obligation to make this happen, and it is morally wrong to ask children to bear a disproportionate burden of the cost of the pandemic. Yet the lockdown policy, and especially school closures, guarantees that children are especially harmed. Online learning is not a good substitute for in-person teaching. For normal development, children have a strong need to socialize with other children, to make friends, and to play with one another. Online learning, masks, and social distancing all impede these critically important normal activities. Schools are also the main point of contact with care systems and provide a refuge for disadvantaged children. Furthermore, the risk from dying from being infected by COVID-19 for children is very low, lower than the risk of dying from the seasonal flu. Schools do not close due to influenza, and neither should they close because of COVID-19. Declaration has been signed by nearly 13,000 medical and health scientists and by nearly 40,000 medical practitioners. I highly encourage each of you to review the frequently asked questions of the Great Barrington Declaration by visiting. And he put a webpage down. In addition, Dr. Bachara wrote an article titled A Sensible and Compassionate Anti-COVID Strategy that is also an insightful read as North Carolina leaders considered renewed lockdowns. This can be viewed at, and there's another link. In short, keeping kids out of school has substantially negative side effects that our community and state will be dealing with for years and decades to come. Please do all you can to move forward, not backward, in a plan to return to normal. Nearly 14,000 children affected by your decisions are not in a position to lead, which is why your leadership is more important than ever. Thank you again for your service to Henderson County. Ms. Caskey, you can go next.
This one is from Courtney McCall. Once again, I want to thank you for your service to the board. I know this year it has been more stressful and trying than rewarding, but you have worked hard. Thank you. As a teacher in HCPS, I would like to implore you as a board to consider 2 items. 1, letting 4th and 5th grade return to face-to-face 5 days a week, and 2, a more accountable attendance work policy for virtual students. As a 5th grade teacher, I see firsthand the need for my students to be in person every day. On my virtual days, I am seeing less and less attendance and participation. Students log in and then simply disappear and do not participate in any way. I have students who log on for literally 37 seconds and then log off because they know they will be counted present for being on the meet. I have students who do not work at all quarter, and then the last week submit 18 assignments for full credit with the help of who knows who at their house. We are setting them for failure in the real world when they will be expected to be present every day for jobs and will be expected to complete tasks in a timely manner. I fear I will see a handful of my students again next year because I cannot in good conscience send them on to middle school as ill-prepared as they are from the mess that has been virtual learning. Thank you for your time.
Thank you. Mr. Bridges.
Subject to COVID-19 with community partners. Good afternoon. My name is Alicia Hawkins. During the first part of the school year, we offered a safe and distant physical learning. Summer camp, we have relied on our operation. We are able to offer some scholarships for our programs. We are not able to offer completely free care at this time. This limits our ability to serve our community in this time of need. If the situation arises where you are faced with the difficult decision to place our students back in a fully virtual school day, please consider working more closely with community partners in order to serve more students. While smaller classrooms may not be the safest environment for learning, when cases are climbing, there are spaces throughout the county at churches, camps, retreat centers, school gyms, and cafeterias, etc., where students can safely learn spaced from each other. Can we better work together to utilize these resources to serve all our students whose parents desperately need to work and who are unable to help their children? I am absolutely available to brainstorm and to help figure out safe ways to serve our kids if this is a possible discussion in the future. Thank you for your time, Alicia Hawkins.
Thank you, Mr. Bridges. Dr. Addis.
Hello, and thank you for your time. I'm a parent of a student enrolled in Henderson County Public Schools. I believe many people will be traveling this holiday break, and the chance of illness spreading is increased exponentially. Please consider remote learning for 2 weeks after Christmas break to lessen the chances of community spread amongst teachers, staff, students, and ultimately our entire community. I know 2 weeks is hard on many parents. There is no answer that will satisfy everyone. My personal belief is if this gets out of control, we will have much bigger problems than an extra 2 weeks of remote learning. An increase in the spread of COVID could reinstate fully remote learning until clusters of COVID subside or more governor mandates that will further hurt our community. It seems other communities and universities are adopting this approach, and it makes a lot of sense. I know kids usually show weaker symptoms than adults, but our community is full of retirees and older folks who need the young and healthy to fight for them. 2 weeks is not a lot to ask if it saves our families and neighbors' lives and reduces the chances of more government mandates on all the small businesses in our home. Thank you for your consideration and time spent, and this is from Sarah Smith.
Thank you, Dr. Rose. Ms. Case?
This is from Jessica Freeman, subject virtual. Please consider full virtual distance learning after winter break. Do not add full 4th and 5th grade classes. Not safe at all. Protect your staff.
Thank you. Ms. Holt?
So this is from Sharon Blythe, and the subject is, please consider a delayed return. As our state numbers climb, so do the number of cases in our schools. While Henderson County Public Schools have done a great job in their attempts to control COVID cases, none of us have seen the number of COVID cases that we are experiencing. I urge the board to consider a delayed return to school after the Christmas break, engaging in remote instruction through January 15, 2021. This will allow cases that have spread over the holiday break to manifest. After that time, school should continue on the modified Plan B that is being used with greater attention paid to social distancing. This is a matter of life and death per our governor. Put the safety of our children and the teachers first. Thank you, Sharon Blythe.
Thank you. All right, the last one we have is from Kathleen Abraham. This one was sent to us with the also with 96 other teachers that have essentially signed on.
56.
It's at 156. So as of when I got this, it's 96. But this is what the message reads. To the members of the Henderson County School Board, this letter is to make you aware that many of the teachers and staff of Henderson County Public Schools are concerned about the exponentially increasing number of COVID cases and subsequent hospitalizations and deaths. As these numbers rise, our jobs put us at particular risk, given our extended exposure to numerous people in enclosed and poorly ventilated spaces. Our students and their families often do not get tested for COVID, so we are not confident in the accuracy of the documented number of cases. We know the jobs of many other people put them at some risk, but there are also companies and school systems that prioritize the health of employees and students and have put interim strategies in place while waiting out the pandemic. This is evident in many other counties in North Carolina and in other places around the country. We have heard the concerns from all those affected by our students' access to education, and we do understand and appreciate the unique challenges. We recognize that, despite our best efforts, the educational settings during the pandemic have not been optimal for learning and will not be until we have this virus in check. We also know that the end is in sight, but as deaths in the United States crest 3,000 a day so far, and upwards of 10% of COVID positive people still have debilitating symptoms months later, we are justifiably concerned about ourselves, our loved ones, and our students. As you make these difficult decisions about how education should be executed at the height of a local and a national public health crisis, we ask that our health and our lives be an important factor in your decision making. We ask that your decisions be tied to metrics and that we make future plans based on those metrics. Sincerely, and then the 156 teachers and staff signed off on that. So those are our public comments today. They will be posted like normal online tomorrow. And so everyone will be able to see that. So next up on the agenda is the consent agenda. I will take a motion to approve the consent agenda.
I move we approve the consent agenda as presented.
Do I have a second?
A second.
All right. Ms. Case, yes, no?
Yes.
Mrs. Holt,
Yes.
Ms. Kasky, Ms. Bridges, Dr. Revis,
Yes.
Ms. Driegoff,
Yes.
and I'm a yes. All right, now we are going to move to return to learn. Dr. John Bryant. And Mr. Smith, you're welcome to come down if you'd like to join him or whenever.
Thank you very much, Mr. Chairman and members of the board. This will be an opportunity for us to share with you a little bit about where we are at the current state, to answer any questions that you might have about our school system operations and talk to you a little bit about where we will go moving forward. And I do want to say a very special thank you again to Mr. Steve Smith, who has agreed to join us. He's the director of the Henderson County Department of Public Health, and no greater ally to our school system and to our school communities than the support that's being provided to Mr. Smith. He still answers the phone when I call, which is a really, really good sign.
Still.
And we appreciate that, and continues to provide regular communication on behalf of the health department as it relates to our school system operations. The first information that I want to bring to light is the same information we've been sharing with you since January as it relates to the Harvard Global Health Institute's data metrics as it relates to daily cases per 100,000. We've been tracking this information, sharing with you the trends on this information. And again, the most recent data all the way through December the 7th, you can see where the data is trending and you can see the direction that it's trending. I think it's important to understand this because this is part of the information that we've been communicating to the board about what informs our decision making. With that in mind, though, I do want to also recognize that this does not accurately depict the information as it relates to positive test cases among school affected. So students who are attending face-to-face instruction, staff who are providing face-to-face instruction. When you think about that percentage, when we last calculated it in late November and in early December, it's less than 1%. It's less than 1% in our schools. So as it relates to how this information is interpreted, I bring that to your attention as well. Additionally, the North Carolina Department of Health and Human Services developed a county alert system report recently. It is a biweekly report that's published for the entire state of North Carolina. It identifies individual counties, a current tier, meaning the risk level that's associated with that, the 14-day case rate per 100,000, and then a 14-day % positive rate, as well as the local hospital impact. When you look at this information, you can see Henderson County listed here. Again, this information is as of December 8th. And I think it's really important to note, this is historical data. I think Mr. Smith would back me up on this. Again, this is not real-time information. You're looking at information that's been captured over time and then published afterwards. So we get 2-week data points that are put together with this. And I'll specifically just highlight Henderson County as of the December 8th information. Again, you see the categories associated with in our previous categories. Mr. Smith, when is this data published? Is it every other Friday? Is that every 2 weeks? Okay. I'm sorry. And so then we also have a district dashboard that publishes information related to specifically to our schools. The COVID dashboard's been located on our Henderson County Public Schools website since we began publishing that information. And specifically, I'd ask you again to notice the trend data here. So this is the reporting of school-affected cases. So I want to be very clear about what those numbers represent. They represent students who attend face-to-face instruction or staff who are assigned and serve a particular school community. So of note, one of the most frequent questions I get is, what if a student is entirely remote? They only engage their instruction virtually. They would not be reported in these numbers. Again, if a staff member of the school system does not serve a particular school community, they are not reported in these numbers. These numbers are reflected based on individual schools. What you can notice is last week through the weekend, December 7th through December 13th, that rate has increased considerably over time. And so it's important to note that we see that trend data on the district data dashboard. As a reminder, what communications are occurring by the school system? And most importantly, right now we are communicating to families. When you look at that district data dashboard, each and every instance of a school-affected case, we notify that school community. That does mean that some schools are getting a phone call every night. That does mean that sometimes a school will receive several phone calls a week. But what we've committed to our families is letting them know that information so that they can make informed choices about their students attended at school and keeping them posted of that information. What we are not doing is providing personally identifiable information. We've shared that with the board several times. There have been lots of questions about, tell me what grade that student is. Tell me what class they're assigned to. Tell me which teacher that was. We don't provide that information. It's not shared with parents and families. Again, we protect the personally identifiable information of an individual. And we also don't immediately close schools for a positive case, as this board is well aware. What we do is communicate that information to our family and then adhere to the practices that you see listed here. In terms of understanding how we are operating right now, this slide has been, again, in every presentation since July, reminding everyone what Plan B means as it relates to the guidance that we've received from state officials, the Department of Public Instruction, and the Department of Health and Human Services. First and foremost, that a remote learning option needs to be available for every single student, and there is one. That there is an expectation and a requirement to adhere to face covering requirements, social distancing requirements, cleaning and disinfecting schedules, and limiting the non-essential visitors and activities, as well as the use of our facilities for outside groups. We have discontinued all activities that involve bringing large groups of people together, so that's the cancellation of assemblies, performances, field trips, and otherwise. And of course, currently we're adhering to school bus restrictions that exist, which allow for only one student per seat on a school bus, unless they're siblings. So right now, that's how our transportation works. We continue to utilize daily symptom screening for all students and staff, including the temperature screening, which has recently been moved. Ms. Holt has spoke earlier about how cold it's been. We have moved that inside. As you remember, we started the school year, we were doing temperature screening in car rider lines, or as directly as students were getting off the bus. We had to move that inside to ensure that our digital thermometers are reading more accurately. I want to pause for just a moment right there as we talk about our current operations and how we're reporting information and what metrics are being used, to see if there are any questions from the board before I continue. Okay. All right. Under Plan B, remember we have a fully remote option. You see that on the far right-hand side. We've been tracking the attendance rates, or essentially the percentage of students who are coming on A days, students who are coming on B days, those who are attending every day, and then our fully remote option. You can see that our fully remote option has started to tick up a little bit. Again, operating at about a 70-30 clip right now across the school system. We'll remind the board that that is a different percentage at every school. All right, so not every school is exactly 70-30. Some are more or less, but across the entire school system for our enrolled students across that 13,000, approximately 30% of them are fully remote all the time. I'd like to take a moment, if the board will grant me such time, and really talk about what the highlights have been to this point. It is almost unbelievable to consider that we are in December and the year that is 2020 might actually end at some point. But over that period of time, really since March, there have been some extraordinary highlights. There have been things that this year cannot pass without acknowledging many of those things. And I want to start at the top of the list with the two most important groups of people. Our teaching staff and our students have been unbelievable. And they've been unbelievable in ways seen and unseen. The things that we know and the things that we don't know. The things that they've been willing to do and the things that they have been without hesitation to do. Being an educator in the modern world means we're going to ask you to do a lot of things and oftentimes all things, right? To serve in every way that a child or a community might need. And our teachers have answered that bell over and over and over again. They've created instructional strategies that never existed before. They've created digital learning environments that never existed before. They have facilitated, they have changed, they have navigated uncertain health and safety, all of which is at a time of commitment to the children, that group of people who have said, we're also going to show you what resilience looks like. Over and over and over, our kids are the ones that are doing the best teaching right now because they're showing us what it looks like to be committed in very, very difficult times. With that in mind, we cannot say thank you enough to the families that have been supporting them. The mothers, the fathers, the grandmothers, the grandfathers, the aunts, the uncles, the neighbors, everybody who's kind of been a teacher at some time or another right now. Maybe on A day, maybe on B day, maybe on Wednesday, maybe all of March and April and May and June. They've stepped up and said, we're going to teach. We're going to be part of the fabric of support for a child's education, even when it's impossibly difficult. We will not stop being servants to the kids in our community. And it's been awesome to see. To our school leaders who have held that helm without really knowing how we were going to get there, but have said, we're going to steady the ship and we're going to do everything we can do to put that together on a daily basis over and over. We cannot say thank you enough to the people that are choosing it right now, who are saying, it is impossibly difficult and I'm still going to show up tomorrow. I'm going to still be there tomorrow. Not because it's easy, but because it's hard, and that's what our schools and our school communities need. To our school nurses, these individuals are leading the way when it comes to ensuring the safe environments of our schools. I was talking to one on Friday when we were having our school visits, one of the amazing women who serve as a school nurse in the community, and they said, in many respects, our entire job has changed. And I thought, how true that is. How true that is. And yet, a willingness to say, I will allow my entire work to change and then do the new work because that's what's needed, because that's what needs to be done. These individuals have been exceptional in their service to our communities, coordinating the contact tracing, making the determinations about health and safety opportunities for our children. They've been extraordinary. To our support personnel, the men and women who drive a bus, who clean our schools, who support instruction, who answer the phones, who do home visits, who deliver food, who answer technical questions. Every person who said, I'm going to support every avenue of student learning needs to be given immense gratitude. Thanksgiving is not a day right now. In a global pandemic, Thanksgiving should be a daily attitude. It should be a commitment to say, we are so grateful to everybody that chooses to make this happen and to be a part of this, who says, I'm going to be here for you because you need me. Our support personnel have shown up in that way day after day after day. Recently been in 3 or 4 meetings that have required a group of personnel from all across the system to be participating in a conversation on how we can better support students. And one of our social workers in each of those meetings has been participating on his phone in his car because he was delivering meals to families who needed them. He was participating in a meeting between meal delivery. I thought, what? Is there a better example of what it takes to do what we're being asked to do right now? Those words you see at the bottom are represented by daily choices and commitments. Books should be written about 2020 to define what resilience is, about what flexibility is, to think that you know where you're going and 5 minutes later to have to change. We talked to teacher after teacher after day 1 of our hybrid planning in Plan B on September 21st, who said, okay, so here was the design of remote learning on day 1, and I'm changing everything on day 2. And there was a reason they were changing everything, because they learned. They were being the lead learners. They were saying, you know what? We tried something, and I thought it was going to work, and it didn't. Great educators are willing to say, and I'll change course. I'll do something different tomorrow. Well, we've had folks doing that day after day after day after day. The creativity and the innovation, there are endless examples of being asked to craft new and creative ways to engage kids, to work with kids. Our resolve, as I said before, it's December and we're here. We opened schools under Plan B on September 21st, really with a core mission: to open and stay open, to serve our kids safely, to care for our staff, to stabilize a community. And that has taken a tremendous amount of resolve. Last but not least, this word grit. We talk about it a lot in education. But if there was one thing that we could give every child with a diploma, it's unwavering grit. That you could face challenge with confidence because you've seen it, because you've done it, because you've been there. This slide is about that. It is about saying, I am prepared for the unknown. Because I've done it day after day after day after day after day. And it's worth celebrating right now. There's so much that is so difficult. There's so much fear. There's so much concern. There is so much that is true about how we all feel right now. We also have an opportunity to really celebrate what we see, what's done, what we're doing, where we're going. It's powerful when we think about what it takes to care for a community. It takes that web of fabric all the way, doing that work together.
And the church said, amen.
Amen. Amen. That is not without challenge. And I think it's important that we are always
Right here.
open and transparent. I know we're not turning to the benediction just yet. There is daily challenge with that. Celebration does not turn a blind eye to what makes it really, really difficult. Celebration is saying we know it's really difficult and it hurts and it's hard, but let's acknowledge the things that are especially difficult right now. We are seeing increasing trends of staff and student positivity. No two ways about it. I showed you on the dashboard. This last week was 3 times higher than the 3 weeks before it. That is a fact. It's real data. Staffing coverages and the limitations and lack of staff substitute personnel is a real thing. Every school right now is without staff who cannot report to work for one reason or another. Maybe it's because of contact tracing protocols. Maybe it's because of quarantining directives. Maybe it's because of a concern in their own home or with their own health. That's real. As each of you know, and I will touch on it right here, we had to move Bruce Drysdale Elementary School to fully remote for at least 3 days last night. At 5 o'clock, we had to call parents and families and say, this entire school community has to move to a fully remote environment. And the reason was staffing. The reason was we could not safely instruct, supervise, and operate a school. And as a board and education system, we talked about that. We said that this could be on our horizon. This may happen. And we have to be prepared to do so and then choose to do so when it's necessary. Put those puzzle pieces up there for a reason. We are piecing it together in many places. We had a school just before Thanksgiving not have a single bus driver. Not a single bus driver was available for that school. And what did they do? They pulled classroom teachers and coaches and administrators and other personnel who had CDLs who could serve as bus drivers so that we could keep that school open that day. It has taken people being willing to do anything and everything in order to keep schools operational right now. We know that it has been critical to ensure compliance and discipline with community health practices. Be the very first one to say, we are doing our very best, but we acknowledge that every day we've got to re-emphasize those behaviors in order that we have safe schools. The coordination and communication during quarantine periods, I'm proud to say our communication is especially powerful. But I can be honest with you and say that when the CDC changed the guidance from 14 days to 10 days to 17 days, depending on circumstances, that created a lot of questions for us, right? Well, I'm sorry. Yeah, exactly. Mr. Smith kind of waves his hand, but there were many of us who kind of went, okay, so how do we navigate 3 sets of rules? Especially and communicate that clearly and accurately to families. Also understanding that quarantine periods are relative to the time of exposure. So it's not the time they told you is 10 days from there, or 14 days from there, or 7 days. It's the time in which we can determine that nexus of exposure. And so that's critical to understand that we've been having to navigate that. School nurses have been navigating that. And sometimes with immense support and other times with immense disagreement. Not everyone is happy about being told they have to stay home for 10 days. Understandably so. But it's a necessary piece for our schools. The next to last bullet is critically important. What's a regular challenge? Several of you are parents of students who are participating, and many of the parents who are listening, waiting to hear about our decisions moving forward, recognize student engagement and staff morale are absolute realities. And we have, as an administration, absolute concern about both. We know how challenging it is to navigate multiple environments, even when you've chosen that path. We know that asking staff to continue to roll that rock up the hill over and over and over is exhausting work. We know that when parents are acting as teachers at home and navigating 3 or 4 students who are learning virtually in their own homes, it is extremely difficult to be a working parent and to do that
Yes, sir.
at the same time. That's why that last bullet becomes so important. We could order something right now. We would order an excess amount of patience and grace. We'd hand it out freely to everybody as much as we could. That we would look every person that we talk to in the eye and we'd say, I understand how difficult this is. We need to be thoughtful and caring to each other in that respect. Those challenges are real and they're part of our work. But they also help us inform what we do and where we go next. And I think it's critically important to talk about, as we said, there is a finished calendar year in our future, 2020. There's a finished calendar year. We hope a lot of other things end with that year. There's a finished calendar year. But when we think about where we go next, we talk about the uncertainty and what we see in the information and the data points that we pay attention to. We have to be prepared as a school system and as a board, and the leadership team fully recognizes this. We have to be prepared to immediately transition between plans if necessary. We demonstrated our ability to do so by what took place at Bruce Drysdale Elementary School. We recognized the staffing shortage. We communicated with that group, and we delivered a transition of those plans for a period of time until we can adequately, safely supervise, instruct, and support those students. We also, third bullet, I love the song 12 Days of Christmas, but I want to share with this group, like the 12 days after this Christmas could not be any more important for us as a school system. There are 12 physical days in the calendar after Christmas before students return to school on January the 7th. Those 12 days are an opportunity for our community to really lean in to holiday or healthy holiday habits so that our students can safely return to school on the 7th, so that our staff can safely return to school on the 7th, so that our schools can operate safely on the 7th. We talk about built-in quarantine periods. There's an opportunity in our school calendar to really lean in to that. That in mind, though, we have to monitor the community health trends and the workforce stability. Every day that changes. I'll use Bruce Drysdale again as an example. We have to be at the ready to make a decision if and when we have to change direction. Because if our workforce cannot safely instruct, supervise, and support students, we have to change course. That is critically important. We have to continue our district communications to keep parents and families informed. Several people laughed at me yesterday. We sent 2 messages to the Bruce Drysdale community. We sent one at 5, we sent another one at 7 on purpose. I remember being told one time we would rather have people complain about being over-communicated with than under-communicated with.
Absolutely.
Boy, we're trying to meet that challenge.
You're doing a good job.
Thank you. I'm going to practice the gavel, but the communication.
You can send
Communication with
anybody
God.
to me that's worried about over communication.
That's
Just
right.
send them right my way.
Yes, sir. Absolutely. We also need to think about where we're going from our planning and our operational standpoint.
Good.
And I want to share on this particular slide, we've talked frequently about 4th and 5th grade students under Plan A, which is permissible under the governor's current orders. What we recommend on this is that we plant that flag in the ground on February the 1st, 2021. And there's a very specific reason for doing so. Not because we know for certain the future, or because we know for certain what community health will look like at that time. But what we do know is where we hope to go is to a point when all of our kids can return safely to school. Not just kindergartners and first graders and second graders and third and fourth graders, but sixth graders and seventh graders and eighth graders and ninth graders, 10th graders, 11th graders, 12th graders, and super seniors. We want them all. Want them all. But we have to pay attention and we have to have time to plan and communicate. And planting that flag on February 1st doesn't write anything in stone. Absolutely does not. This board will meet again on January the 11th. We will have another opportunity to look at the health data, to look at how the school system is operating at that time. But what we will do is say, we need to begin the planning in order that we might be prepared to do that. Should it be safe to do so for our staff and for our students? As you see in that next bullet, we would prepare in greater detail the details of that plan at the January 11 board meeting. And that, last but not least, is to choose to do so is just like we chose for kindergarten through third grade. It's to understand that when we plan that right now, the social distancing expectations within classroom environments for all fourth and fifth graders would not be able to be met if we choose to go down that road. And school buses would be required to transport more than one child per seat if we chose to do that. And I want to note the if. Putting a flag in the ground and having a goal is about the work that we're doing operational. It is not, again, written in stone. It is not a finalized decision, but it is necessary for us to plan and communicate and have that on our community's radar. I'd like to pause here for a moment, see if there are any specific questions about this information as it's been shared with you so far.
Can we ask Mr. Smith some
You
questions?
know, I think Mr. Smith was hoping you would ask him a question, Ms. Case. I knew that he
I've
was,
got 4 or 5.
you ask as many as you want.
Are we still yellow as a county?
This song, John?
It'll be bright green light.
Okay. Can you hear me okay, Ms. Case,
Yes,
with this mask on? We are or were as the date of that report, and I think that goes back to December the 8th.
But we've
One-
had a big surge.
Well, one of the humbling things I would share with this board today is that by the time that report is generated again, I would expect us to be orange or red. That trend exists for all jurisdictions in the state today.
When a parent tests positive for COVID and the kids in the house are quarantined, do you all let the schools know who's quarantined?
Yes, ma'am. We have a very good system in place with the school nurses, Dr. Bryant, administrators at those schools to make those connections. In the coming days, with the volume of cases that we have now, it's going to be challenging to do timely case investigations and contact tracing with all cases, but we know that schools are one of our top priorities to continue that model.
I want to know how your school nurses are holding up under this because they are under intense pressure.
They would agree with you, but no more so than anyone that is operating in those schools, as Dr. Bryant said, staff and everyone else. So they're thankful to be part of that kind of unified team effort. And we're glad that we have them. This board was very forward thinking in adding school nurses, so we're in a better position than most school districts.
Okay. There's a lot of questions out there about how the tracing. I know you've been through this before, but will you go over that again and tell us when a child gets or becomes positive, how do y'all trace that?
Well, we're depending on the age of the child, I would say that most of the time we're talking then with the parent of that child or guardian. And so we're just going back in time either to the time that they became symptomatic, if that's not clear, 2 days before they were actually tested, and understanding where they've been, who they've been around, and for what periods of time, particularly trying to establish what the close contacts are of that individual. We would then notify those people to stay quarantined so that they don't present a further transmission risk to others.
Okay, and teachers who are in high school, especially in middle school, maybe, when they're in the classroom eating lunch with the kids and there's no mask on, and one of them gets tested positive, do y'all quarantine everybody, or how do you do that when they've been in there for 30 minutes with no mask on eating lunch?
Again, I think I think they have to be evaluated on a case by case basis, exactly kind of what physical distancing is involved if they have not had mask on. I think they're trying to avoid most of those direct kind of face to face interactions. But if we think there is that proximity and that time length of exposure, we would quarantine that cluster of folks that were involved.
Okay. Back in the beginning, we talked about Harvard a lot, and we saw the thing up here today, and we weren't going to go back until it was under 10, and now it's up to 24 or above.
Yeah.
Have we just discarded Harvard?
No, the humbling thing I would tell you today, because John shared me an early preview of his slides, at the day, that's over 40 cases per 100,000. So it's extraordinary. Part of that is the Thanksgiving surge, but part of it is a increasing trajectory of cases, again, that we see throughout the state. What I said to this board when we first talked about coming back in with K through 3 was that 10 or less open the door, but going above 10 in the future would not close the door. And what I mean is that at that point, once school was back in, there was an agreement, I believe, with this board that we would take a hard look at what was happening inside the schools, specifically whether or not transmission was happening in the school, and if they in turn were then presenting a risk to the community. That has proven not to be the case. I think you've experienced exactly what we expected. The cases you're identifying in the school can be linked to epi exposures outside of the school environment. I only know of one limited exception that's where there was a potential staff-to-staff transmission after school hours in a school environment. So it's commendable that we have controlled transmission inside the schools for this period of time.
During the 12 days after Christmas, and you have positive cases, you are going to let the schools know, or the principal or John or somebody know that those kids have tested positive, correct?
Yes. I mean, even when we're not intercepting them in the school environment,
Right.
Any child that tests positive, we're kind of tracing back to school rosters, making sure that if they are connected to a school environment, that's something that we act on.
But not virtual kids.
Not for this purpose. I mean, we're interacting with them as cases in close contacts regardless.
If I could, just kind of, the health department is still responding to any positive case in the community as it's reported to them, but we don't report virtual. Students who are in a remote environment are not part of our reporting. But to your question, if we had positive cases that were reported to the health department and then confirmed by the health department over the Thanksgiving break, we were made aware of those, and then we published those, when we returned to school on Monday.
Okay, and all cases, no matter where they're tested in Henderson County, they get reported to you guys.
Not entirely, Ms. Case. That's a tricky thing, is that cases that get reported to me are tied to Henderson County residents. But on occasion, there may be an odd student or student family that's not directly reported to me, but we would still capture them if they're tied to school enrollment here.
Okay.
I have quite a few questions too. Thank you for coming. I hated to ask you to come, but I feel like it's imperative that the public hear from you.
Sure.
So one of the things I want to talk about is the reporting that's done. I have been told that there are employees of us who feel that the dashboard is not correct and we're not reporting all of the cases. Would you know to be that the cases you're giving us, we're does it sound sufficient, the number that we have now, 142?
I think there's a very reliable model in place today to vet and substantiate those cases. I get direct electronic reporting from laboratories, and even entities that are doing point of care tests are reporting to me. So I have no reason to believe today that there are cases that are going unreported, unless someone just sees someone symptomatic and assumes they are, but we don't have any kind of laboratory confirmation to back that up. That's the only circumstance I can think of in this whole.
Okay. And then you talked about the one case that you know of where it's possible that one staff member gave it to another after hours. Would those employees have been within 6 feet without a mask? Do you know that specifically?
I don't remember the details of that particular event.
So would you say that if our staff, and I know it's hard to control our what the kids do, we always try, but if staff is wearing, because we're getting a lot of emails about staff being apprehensive because of the rise in cases, but if they're social distancing and wearing a mask, we've only had that one instance that we know of where it's been a case is directly from within the schools. The rest of them have been, they went to wherever so-and-so's football game and got it from there, whatever it is. It's all from like I know my son's school, there was a bunch of them got together and had a party. And so there were some kids that tested positive because they were at the party. They were members of the school, but they didn't get it at school. They got it at the party that they were at.
Yes.
So would that sound accurate?
Yes, very much so. I mean, it doesn't take but just a moment in dropping your guard and that can happen. So it is very innocent. But staff have been amazingly compliant. Again, your staff-based cases are linked to exposure risk outside of the school environment.
Okay.
They've done a great job.
Okay. Do you feel like the 12 days after Christmas that we have off, that is sufficient? And this is just, I know some people are going to vacation longer, but my thought would be if I was to have family or go see family for Christmas, I probably would be home by like that Sunday to start work back Monday. Now I know there are people who, are exceptions and have off longer and might be at family's house longer, but as far as like family getting together for Christmas, do you feel like 12 days of our staff and students being off would be sufficient enough?
I've talked at length with Dr. Bryant about this and Dr. Curran. That's a pretty decent gap of time that almost equates to a full quarantine period. So I think once family, if they have those kinds of holiday interactions, which we're not recommending,
Right.
I think that is definitely time because most people evolve with symptoms in that 5 to 7 day range. That is a really great period of time for families to identify if they do start feeling strange or start feeling symptomatic to give us an early clue what we may be facing before school comes back in.
Okay. And there's two more questions that I have. One is, what is the probability of our teachers, especially the high-risk teachers, if they so choose to be vaccinated, could be moved? Now I know, people in nursing homes and hospitals, direct care, they're high on the vaccination list. But if they chose to be vaccinated, would the county consider them more at risk because they're in the school system and they could be possibly moved up?
Potentially, and I can lift that question up. I'm not sure if you've had a chance to share that prioritization framework. There's phase 1, 2, 3, and 4. You've heard these?
A little bit. I know 1 and 2.
Okay. So phase 1 is divided into 2 sections. 1A is what you would expect, frontline healthcare workers and long-term care facilities, residents and staff. 1B is getting into a little bit broader category, other essential personnel, for instance, like law enforcement. And then potentially that might be a niche where we could fit the highest risk school staff into. Right now, as it stands, it's got, just looking really quickly, it's got education staff in general in phase 2, but it is saying without 2 chronic conditions. So I think, again, we
Okay.
potentially could put them in that 1B category.
Okay, that's great to hear. And then my last thing, and I promise to leave you alone. Do you feel that the recommendations that DHHS Mandy Cohen made and Roy Cooper made for our 4th and 5th graders to go back to school full time, do you feel like that is attainable and that is something that we should definitely consider doing?
I always listen to their perspective, and I think they're important in that respect from a statewide look. But the people that matter to me in terms of making that decision are here in this room. And I think we collectively, public health, the Board of Health, and you, I think we know what's best for our community. And so just like we've done in the past, I think we just dig through that and we figure out what makes sense for us.
Okay.
All right, and piggybacking on that, I've got 2 simple questions. One, with the rate you said, it could be up as high as 40 as far as the Harvard Global Institute per 100,000. Should we close down schools right now?
Not based on data that I see today, Mr. Craven.
Okay. And do you think our practice of essentially going case by case on a school basis, like we did with Bruce Drysdale this morning or last night, is appropriate in this environment?
Yes, we have vetted through these possible scenarios.
Yeah, right.
And I think one of the things you and we both acknowledged early on is that you almost get into a default closure position because of a lack of staffing.
Yeah.
So you've done a great job at anticipating some of these challenges.
Thank you.
I have a couple of questions. If after 5 days off, we saw a spike where the number of cases tripled, what would we expect to see after they're off 15 days? Because I don't necessarily believe that Christmas midnight, everybody stops
Right.
meeting with family and doing irresponsible things. You talked about community commitment.
Right. I guess I'm not tied completely to what effect the holidays themselves may have. I mean, prior to seeing, at least in part, an increased surge today because of Thanksgiving holidays, but that increase in cases was already happening before that holiday. And it's hard to know what part of that is the effect. So I think Christmas could be significant in exacerbating our circumstances, but I think our general community trend at large is what we really have to tie to and link to. And that trajectory is difficult in the days ahead. I want to be clear about that.
So if that Harvard Global number, which we're guessing is about 40, if that were to triple based on the 15-day holiday hiatus from rules, I mean, would 120 be an acceptable number for the students to be back at school?
You'll never get there because somewhere between now and then, you won't have enough staff to run schools. You just absolutely will not. I mean, cases are so prevalent now that many organizations are struggling in terms of day-to-day operations.
Sure.
It is unimaginable to me to get to that rate, but there are some counties today that have more than 100 new cases per day. And so that's difficult space to kind of process and comprehend.
So if we were in that range, would you consider it acceptable for the students to be back at school?
I would have a lot of caution about being in that predicament. I think you have to marry it again with, is transmission actually happening in schools? And then it becomes a difficult kind of equation thing of where are the kids better off? I've said something that's a little challenging, I know, for folks, but honestly, the protective measures are so strong in the schools. You have to accept that some kids may be better protected in the school environment than they might be if they were at home and like a neighborhood was having parents kind of round robin with keeping them out. So, I don't think there's a great perfect answer there one way or the other.
And that does seem true, but I don't think the teachers would possibly agree with that they're safer having those students who for 15 days were not possibly wearing masks or following social distancing rules being back with them.
I agree those staff concerns are difficult to address and will be as cases rise.
Should that staff be more concerned with other staff members per se than kids at this point as far as transmission goes?
I think you've just asked me a question I don't really want to answer. Chairman Craven.
Anyone else?
I've got,
Yes. Oh, yes, Miss. Yes, sir.
you got something? No, you go ahead, Kathy. There's so many kids that are supposed to be asymptomatic. Do you know a percentage? Have you heard that anywhere in your medical stuff of what percentage of kids can be asymptomatic and still be carriers? Or they are carriers?
It's all over the map, Ms. Case. So I don't think I could give you a hard estimate, but we have seen a significant percentage, and I'm just thinking not just about kids, but all cases that are asymptomatic or have extremely mild symptoms that they don't recognize as being related to COVID-19.
But they are carriers.
But they can be
And it can
carriers
spread.
and can transmit the disease.
Mr. Egoff?
I'm just sitting here listening. Sounds good. I don't have anything to add.
All right, thank you, sir.
I've got one to ask John.
Yes, anybody.
Go ahead.
Go ahead.
Those are good questions.
We have had some surge in Henderson County within the past couple of weeks. Do you foresee this continuing or flattening the curve a little bit, or how do you perceive the next 2 or 3 weeks?
I think this continues. I think when you get to a tipping point of widespread transmission like this, I don't think you can reset that with any given action on our part. I think it is going to be, I'm not trying to pull any punches here. I think the days ahead are very difficult. Christmas holidays can be an exacerbation. And one of the things I wanted to make sure that I relay to this board today is that I am fortunate that I have lots of organizations and people call me all the time about what they can do to help and pitch in. And sometimes that's resources or help out with staff, and that is always appreciated. But today, what I would tell you and tell anybody in the community that is listening, if you ask me how you could help, I would tell you today that I need time. I am trying to buy time. This discussion is difficult and we have some challenges ahead of us. But if we can buy ourselves enough time to get to the point of widespread vaccinations, that is the light at the end of the tunnel. I feel like an old Rocky movie, and I've been backed into the corner of the boxing ring just getting wailed on by Clubber Lang. And I am ready to take a little sidestep and get a couple of counter punches in, and I'm really close. If, despite what demands come at us, we will absolutely prioritize vaccinations above everything in the coming days. That is our way out.
Do you think we have adequate supplies for that?
The supplies that are required to do the vaccination?
No, just the vaccination itself. I don't know how much,
We don't either.
Huh?
I think the timing, how much we get and when we get it, that honestly is an unknown. I've seen a lot of promises, but we'll believe it when it shows up on the doorstep. Part D is due for a delivery tomorrow.
Great.
We are due for a delivery sometime by the end of the year. But the unfortunate part about some of the media reports is that's really when the hard part starts in terms of queuing people up, scheduling them, having vaccination clinics. Something that's not being talked about is that the state has this whole management information system they want us to use to track COVID vaccines and how you schedule appointments and how you queue them up for their second dose. Well, it's not ready. So that's a huge challenge for us. In this country, just to give you a scale of what's ahead of us, in this country, we've got about 330 million people. So surveys today say that 60% of the public is likely to take the vaccine. I'd like to get the vaccine to 80% to absolutely assure herd immunity. But let's just take 70% in the middle. That's about 231 million or so. Dr. Revis is going to check me on the math. So, when you think about, normally there are about 285 vaccinations in our country. That's over 12 months. And a lot of that is tied to children who are getting 3 and 4 vaccines at a time. So when you're back to 231 for 70% of the population of the country that will likely take it, and they need 2 doses, 460 million vaccinations in a 4 or 5 month window, that's a big task ahead of us. But we are going to figure it out and we're going to do it. Blair said he's going to give shots. He said he was going to give board members shots.
We have a doctor here we can loan you. We have
Well,
2, we have 3.
He's at the front of the line.
Absolutely. Thank you so. Oh, yes, ma'am.
John, I got 2 questions. One, do you know how many students are quarantined and how many teachers are quarantined at this time?
We don't have an exact number for you today. We're working to kind of get a ballpark. Part of the reason for that is that quarantine number fluctuates just a little bit based on when they were directed, how they were directed, and whether or not, as we talked about a little bit earlier, it's something related to being told to quarantine because they are determined to be a close contact. If they are home because they have a family member who is in a high-risk category, if they've been approved to be in a situation like that. But most notably, not every individual has to submit to us specific leave requests for quarantine. And I'll give you an example. If you're not in a category that requires a substitute teacher, for example, and you're asked to quarantine, we don't necessarily have that as a trackable number. You may just be at home for a period of time, eligible to work from home, eligible to do so during that period. So we're working to get a closer number on that, but we don't have an exact number at any given time of how many people are under quarantine.
Okay. And on our dashboard, you do not include any of our other employees like our bus drivers, or are they?
Bus drivers would be,
Okay.
but transportation staff. So think about, as I was saying, it's school affected cases. So if your job is assigned to a school, a bus driver, a custodian, a teacher assistant, a teacher, a school administrator, you would be reported. But if you work for our transportation department and you're one of the mechanics who service the buses, you would not, because you're not assigned to a school community. There really wouldn't be anybody to call, because they're not interacting with the students or the staff at that school. Our maintenance staff, central office staff, if someone were to we would not be sending out an alert call for that.
But they're pretty important of getting our kids to school and stuff. So
Certainly. And so we think about the public communications, about giving parents information about their school environment. But to your point, those other people are critical to the operation of the school system. So if we were to not have the adequate transportation staff to have mechanics out on the road when our buses were out, we would not be able to operate the school system. We think, as I shared with you, we've got 111 buses that are on the road every morning and every afternoon. We have to have the transportation staff to be able to support them. If we didn't have, for example, our maintenance staff to be able to monitor and manage all of those elements, that would be an element of concern as well. Yes, ma'am, critically important.
Do you have any other questions for Mr. Smith?
Not for Mr. Smith. I have one for Dr. Bryant.
Thank you so much, sir.
Thank you.
Thank
We appreciate it very much.
Appreciate it.
Thank you for being here.
so much. Dr. Bryant, do you have a breakdown of the number of elementary versus middle versus high school? I mean, I know we have, it's all meshed together.
On the
there.
dashboard?
Yeah, on
Yes,
the
ma'am,
dashboard.
absolutely. So for students, we're talking positive COVID tests, and this is since we
Right.
began reporting it.
Right.
Remember, it's a cumulative total. In elementary school, it's been 45 students,
Mhm.
26 staff members. In middle school, it's been 13 students and 11 staff members. In high school, 33 students and 14 staff members. My math is correct. That should all add up to 142. And if it isn't, just remember I was an English teacher. There's bound to be a math teacher somewhere in this room that could help us out. Those are the breakdowns as of today, and again, cumulative totals.
I heard a deal where a kid came to school and one of the parents was positive, and the kid came to school and the school didn't know about it, and the kid was saying, my mom was positive, but she sent me to school. How did that slip by?
How do you mean?
That the kid should have been quarantined at home with mama.
Well, without knowing the circumstance of that
Yeah.
family, I really can't answer that question.
Okay.
I can say that that's why it's critically important that we all take that responsibility that says part of how we keep our schools some of the safest places for kids and staff right now is by doing those things on a daily basis. You know, when we talk about the attestation questions, am I symptomatic? Is anybody in my home symptomatic? Has someone in my family tested positive? Those are things that should inform our behaviors about not sending children to school. I'm sorry, I can't answer the
We need
details
to
related.
depend on parents to do.
We depend on everybody right now. Yes, ma'am. In terms of, recognizing that when you don't feel well, we talk about, is it a new cough? Do you have a fever? Can you not taste anything? Like, those are things that should be immediate clues for us to sort of say we need a big old stop in terms of our exposure to other folks. And that idea of community commitment, when I see those words, that means not just people that work in schools. That doesn't just mean students and families. That's everybody, in order that we have that opportunity. But absolutely on that front.
Do you have any COVID testing going on in the school?
Yes.
Yep. Yes, sir. But the only testing we're doing currently is really two levels. The first is we began doing antigen testing, which is for someone who's symptomatic, but symptomatic only. Okay, so they're not just doing testing for anyone. Where you come to school symptomatic, staff member or student, we utilize the antigen test. A positive antigen test is an absolute positive for the other. So we utilize that when someone's symptomatic and they're at school. The other testing that we have deployed, again, through the support of the health department, is now that the quarantine period revisions came from the CDC, you can return after 7 days. But that test has to occur in day 5, 6, or 7 for the person who's asking for that test. So if a staff or a student member who is determined to be a close contact or quarantined or had potential exposure wants to return on day 7 rather than day 10 or day 14, then that individual can be tested. They can schedule a test on day 7 to return. What we are not doing, Mr. Bridges, is a frequent question I get is, are we doing universal testing? And that's why it's important to understand that when we talk about positivity rate among students or staff of less than 1%, that's just of the people who are, who we have results for. We're not testing every person and then saying that's the result. And I think that that's critically important in terms of when we look at our numbers.
So if I did the math correct, in 3 months, we've had 2.38 cases per elementary school. So that's not even 1 per month per school. Now, some of them are 6 and then, 1 at another. But if I averaged it out in middle schools, we've had 6 per school in 3 months. So 2 per month. Or they're probably, more frequently in the last few weeks because they've been higher. And then in the high schools, it's 7 almost 8 per school per month. And I'm taking, from September 20th, now like almost 3 months. I think those are pretty good averages. No one, I don't want it to be any cases, but I thought going into this, our cases were going to be much higher than what I didn't think that kids would keep masks on either. And they've really done a good job at that. So I think our staff, that it just speaks to the staff and the level of commitment they have at keeping their rooms clean and, making sure kids are social distancing, and they are. And the amount of stuff that we're asking our staff to do at these schools it's crazy. They're doing the work of, not even taking into account they're doing virtual and in-person learners at the same time, and they're having to prepare different stuff. I mean, they're really doing a great job. If everybody else in the community would operate like these schools are, we would be much better.
I have to agree with Ms. Holden, and I would echo something you heard Mr. Smith say about how grateful we are that our schools are very safe places, especially as it relates to concerns around being the site of transmission. At the same time, I think we acknowledge what each of you continue to acknowledge is that comes at great strain and stress for our staff. That comes with great levels of concern. And Mr. Smith said something early and often is everyone has a different level of tolerance for risk, right? Everyone does. We have nearly 2,000 employees, and if you were to poll every one of them, they would all sort of fall on the spectrum somewhere else. And we're trying to honor and support everybody as best we can. You know, those with the greatest levels of concern, those with the least levels of concern, but to do the things you mentioned, Ms. Holt, which is to just be absolute in our commitment to creating the safest environments possible. If our kids are going to be at school, we want to create safe environments. Are they perfect? Are they immune? No, right? Anytime we have interactions with people right now, absent the vaccinations that Mr. Smith talks about, there is risk involved, right? We want to acknowledge that and know that we feel that and that we hear from individuals and groups about what that feels like. What we are continuing to do and what we present and we recommend is a continued effort to say, let's create the safest environments possible to allow for learning to continue to occur for our students as best we can. And most importantly, as you see on this slide and the next, is to recognize that that really is fluid. We know we may learn something a week from now or 15 days from now that requires us to operate differently.
Right.
And the support that this board has provided, the leadership has said, you can do what you did on Sunday. If you need to close the school, close it. If you need to close the classroom, close it. If you need to move that decision, do it. And if we need to circle the wagons as a group because of the entire school system needs to operate differently, then we'll pull this group together. And so certainly because we are in the short rows, about 6 days of actual student days left before our break, right? We have 4 days left this week and 2 days next.
Half.
I'm sorry, half. I'm sorry. Yes, sir. So we have 6 and a half, or 5.5 days. 5.5 days remaining. Mr. Craven likes
Kids
to
will
remind
know
me about the half day. Half day, right? Exactly.
Going back
Kids
to Amy's,
all know the half days.
They
Yes,
know
they can tell you
all
when the half
half
days are.
days, yes. Ms.
Uh,
Mace?
going back to Amy's figures, it shows the bigger the kids, the less social distancing, and the more we have, like in high school. So we need to remember that when we start easing more people in, that we're going to have less and less social distancing and more cases.
Well, I think they also, don't they get sicker and carry it, transmit it faster or something like that?
I am not that kind of doctor. I would hate to answer that question with any kind of accuracy. What we rely on Mr. Smith for is exactly what you saw, is we have this tremendous steady hand
Yeah.
and tremendous partner in our community health leadership. Mr. Smith is on a regular call with me and his leadership with the medical staff. We are in regular communication with our healthcare partners. And one of the things that we rely on him for, just as you saw there, is to tell us the truth, but also be honest with us about what we don't know and what we do know. But what he has always done is been available for consulting kind of how we move forward. And so we have stayed in regular, and I know that over the break you can expect that we will be frequent holiday buddies in terms of talking about where we are and what things look like moving forward. Because as we talk about January 7th, we have to also understand that there's a lot of time between now and then, and we have to be at the ready to make the best decisions possible with the information we have at that time.
Well, unless anyone else has, you have.
And you're going to be our holiday buddy too, right?
Yes, ma'am, I will. As long as y'all keep answering the phone, I'll be good too, but I will keep you informed.
Well, let's summarize this and unless anyone else has any questions and then move on, because we've got a lot of other business. February 1st, you'd like to see 4th and 5th grade back, just like our K through 3s are.
Yes, sir. We'd like to begin that planning and do that work forward, see where we are on January the 11th, present a plan to this board, talk about what that looks like, and then marry that to what we know about community health at that time.
And even with the closing for at least 3 days of Bruce Drysdale Elementary this week due to lack of staff, we are confident going forward for these next 5.5 days of finishing out the semester.
We're going to do our very best, but we are tracking that at every school site right now.
Good deal. Any other questions, comments, concerns?
So, I'm going to ask this. It's either me or Jay that's going to ask. Would it be fair to say that if we came back and things were under control, that we might be able to get the kids that have an IEP in 4th or 5th in full time before February 1st?
We will explore those options. I'm not prepared to answer that without talking to the full instructional services team about our staffing and support, but we certainly are giving consideration to some ways in which we might make some case-by-case decisions to support students who might be able to return sooner than that date.
Okay.
Yeah.
Okay.
Thank you, Andy.
Him and I didn't even discuss it, but I knew it was something he would
Just
ask.
bring that to us January 11th.
Be glad to do so.
Yeah.
All
Absolutely.
right, good deal. We are gonna. It is 5:33. Anybody need to take a break? Are you guys good?
Good.
Power through. All right. Next up is old business. Bernie Sosha and Dr. Bryant and our friend from Enterprise Fleet Management is going to be next.
And if we could, we've just got an updated slide deck to share with you guys, some information that we would like to present. I know we've shared some continued information, and Chad's here to share that a little bit with you. But we're continuing that work, and would like to give you that updated set of information if you don't mind.
Sure. What is new on this?
I believe it's slide 6.
The last 2 slides, Mr. Craven.
Oh, all right, sure.
Again, we're glad to have Chad back with us and appreciate him joining us again, making his way down. But based on the board's request for some additional information as it relates to some comparisons, Chad has updated information and some information about how this particular recommendation for fleet management came to fruition in Lincoln. So Thank you very much.
Mr. Craven, board members, thank you again for having me out this evening. I'm excited to be here, and just based on our conversations last time, added a couple more in-depth analytics, if you will, in a case study. So I know we've got some new faces here from last month, but really what we're looking to explore and what we've done for over 50 other government entities here in North Carolina, and over 1,000 nationwide, is to help you guys reduce the age of the fleet without impacting the current budget. And you can see here up here that we've got a number of local case studies as well to kind of go through those. But really what we're looking at in regards to this meeting is current fleet numbers, as you can see, are right here. You guys have operated a fleet of about 76 vehicles with an acquisition rate or replacement rate of 1.4 per year, which leads to 73% being over the age of 10 years old in the fleet today. As you know, with an older fleet comes safety concerns and things of that nature. So our recommendations here are hopefully to help reduce the age of that fleet to be able to help put safer vehicles on the road for your staff. This is the slide that we considered last time from the analytics. This is taking a look at essentially the first year of a partnership. If you guys were to partner with Enterprise, we've identified 11 vehicles through working with members of the school system to be the most advantageous to replace in year 1. And essentially the goal here is by putting them on a more cash flow friendly method. Instead of paying cash for vehicles, we're utilizing an open-ended lease, which allows the school system to essentially replace more vehicles in the fleet at a budget neutral, if you will, from a capital spend of what was already appropriated of $70,000. And I believe Mr. Craven had asked after the last meeting to show what that looks like over more of a period of time versus just showing, obviously there's going to be a cash flow savings in year 1 if you're financing versus paying cash. So that's what I put together for you all today. What you'll see up here is what we call a 5-year model. And I can speak for our conversations with Mr. Sosha and Dr. Bryan as well, is that you guys aren't opting into, you have to replace X amount of vehicles a year. This is a annually assessed program that we will be meeting with you all multiple times a year to make those recommendations. This analysis here shows that if you were to phase in over 5 years all of the vehicles that made sense to do so, which as you can see, there are about 54 that we would recommend to essentially have on more of a frequent cycle. If you were to do that over a 5-year period, comparing to what you're spending today on items such as capital budget, maintenance budget, and current fuel, you would essentially, over a 5-year period, it would cost you only about $50,000 more, or an average of $10,000 a year, to have a fleet with an average age of just under 5 years, as compared to an average age of, I believe it was 15 or so that you have.
Where'd you get that capital number?
It was provided to me.
And so, Mr. Sosha, how much have we actually spent on cars in the last, I don't know, 10 years? Give me whatever data set you got. So we have $70,000 in the budget this year for 2 cars, right? I know we haven't had any money in the budget for the last several years for cars.
We have been. We've been buying vehicles every year.
Okay, so what was that? What is the average every year that we're buying over the last several years?
We have had 40 to 50,000 for the last 3 or 4 years.
So what concerns me about this is when you start crunching the numbers, you can get down there to 25, right? We're spending $282,892,000 per year, correct?
In payments, yes, sir. But if you see that what we talked about in our previous meeting is essentially just allowing reinvestment from your current fleet. Today, when you're acquiring vehicles and running them 24, 25 years until they can no longer operate anymore, with this model, you'll see there in year 5, you've got over $100,000 worth of estimated fleet equity coming back from those 11 units that you had originally replaced in year 1. So essentially, yes, you will have more capital spend, but it will be offset by the reinvesting from the resale of those vehicles, which will essentially be able to roll that equity into your next vehicles to keep those payments sustainable at much less. So if you take the net of those two, your capital budget will still be higher, but what you see happens when you begin to replace more vehicles more frequently, things like your operating expenses, your downtime, your maintenance, your fuel, those numbers are going to decrease. And it's also going to free up additional resources within the maintenance department and other things of that nature. And essentially all you're doing is shifting where you're spending your money. Again, for what this shows, you guys have an average cycle point of 24 years right now. We're going to move that to 5 years for basically a conservative estimate would cost you $10,000 a year to be able to put your staff, your students in more safe, newer vehicles, if you will.
So the longest you're thinking to keep a vehicle would be 5 years.
No, ma'am. It's tough to put all of your vehicles into one analysis like this.
Right.
And the reason why we were looking at this certain number of vehicles is anything with very specialized aftermarket equipment, any vehicle that's more expensive than your average, light duty truck, sedan, or, cargo van. Sure, we would make those recommendations on. Maybe that's a 7-year. It could be a 10-year. And essentially what Enterprise does over our 2 million vehicles is all we do is evaluate based on market trends, based on how those vehicles are being driven, when is the best time, most advantageous time to cycle out. So we're not going to say it's a blanket statement, 36 months you should cycle or 60 months. It is a vehicle by vehicle, case by case basis. And we essentially, as your fleet partner, would be able to help track that data and then take that data and make recommendations to help better the fleet, make it more safe, make it more fuel efficient, and better for the school system.
I could add for everyone, especially the new board, what you see in front of you at the request of the board to see. So how would what we're asking 1 year commit be scaled for the fleet that is available if you were having Mr. Craven's point, I believe it was your question at the last one. He said, hey, I hear what you're asking for right now, but how will that look?
Problem is, once you
It's
start doing
gonna
this, it never
compound,
stops, right?
right?
Like, this is a continual item in our budget. And if you're looking at the number and we can play numbers games on how much we're going to sell the ones we have or sell the leased vehicles for, and those are all unknowns. We have no idea. I mean, you've got a good idea based on, historical data, but we don't know going forward. But when I'm looking at the numbers, like, we're looking to spend in 2024 $236,000 on fleet vehicles for that particular year. If you're looking at the fleet budget on the right side, that's our out-of-pocket expense, right?
Yeah. So the top number right there in the orange in fleet budget is your current.
And then
Subsequent is always comparing to that number because
Right.
again, I've only got 1 year worth of data. and we're comparing it to what that year is moving forward.
Mr. Socha, our fuel and maintenance costs, are they pretty steady around those numbers that you have there, 5475 and 48022?
Yeah, we look back as best we could to try and pull that for the last few years to see what we've been spending at the maintenance department.
And what would we do with those 73 vehicles that we own currently? And where are they in this cash flow analysis?
We would decide that based on each vehicle, whether or not we would want to sell them or use them. Some of them we don't use very frequently. That's part of the reason he was talking about. It's hard to come up with a plan because some of them we use twice a year. That's why we have them. So if you look at the bottom left.
Yeah, the current fleet equity analysis, but if you look at the little star right below it, it says it's sight unseen. So it basically, they don't even know. They just threw numbers on a page. Right.
You look at estimates, we're talking 11 vehicles from our current Henderson. We're giving them a value of $1,000. Essentially assuming that they have no equity left. By tracking what we would be talking about. Then I think that that's kind of where the next slide is significant from a defense standpoint. The model example of what has been applied.
Yeah, go ahead.
So this right here is a very recent testimonial that from City of Lincolnton, which, as you can see in this subset of about 8 vehicles, that partnership started about 3 years ago. You see the months in service right there in the middle. And essentially what this is this is their first round of vehicles that we cycled out of for them. And what this shows is essentially by what we talked about last time, because government entities buy vehicles less than everyone else and they drive very little miles. And by doing that, if you put them on the right term, the resale equity can essentially help offset any cost that you would have incurred to run that vehicle. So what this shows is right there that $26,000 is the difference between what that vehicle actually cost versus what we helped them sell it for 18 to 34 months later. So the city of Lincolnton actually benefited from that $26,000 above and beyond what they actually leased that vehicle for 2 to 3 years beforehand. And the actual check that went back to them was 103. So after they clear the residual, because this is an open-ended equity lease and the actual equity of that vehicle is tied to the entity and not enterprise, when we sell those vehicles on their behalf, they got the benefit of that, as do all of our other clients on this program.
I have a question.
Yes, sir.
Oh, Jay, I forgot.
What would happen? I heard maybe last meeting we were talking about doing this, but maybe like before, like here you have them, you're replacing them all the way through. Like, what if we did this one cycle to see if it played through? Are we destined for failure if we do it that way?
Not at all. So if you were to do this 11 vehicles, this year one that we've put together, you have all the options in the world. You can essentially use that as the pilot of this program. And at the end of, I think we're going to set these up on 36 months. At the end of that 36 months, we can either sell the vehicles on your behalf, you can extend them out until they're fully paid off and be done with the program, or you can have us essentially replace them and see how that looks on this program. But the intent of that 5-year slide wasn't to assume that every single year you're going to replace that same amount of vehicles. That was to show if you were to roll everything in, this is what you're looking at. But the year one commitment of the 11 vehicles, to your point, Mr. Craven, you're not stuck in this program. You don't have to continue to go year after year after year.
Well, but it would tie up our capital budget that we're going to use for the next however many years that we have those vehicles.
Correct. But as of right now, you are averaging 1.4 vehicles a year with a fleet that's 73% over 10 years old.
Sure.
If major maintenance transactions have not occurred,
Yeah,
they're
they're
going to
coming.
happen.
So no, I get it. We need new cars. We need safer cars, especially for our social workers. Like I understand the programmatic necessity or why we want to look at something like this. The problem that I see in a lot of these type of situations is once you get into them, it's hard to get out. And so that $70,000 that we have to buy 2 cars this year, well, then is going to go to you for that lease for the next couple of years. And we couldn't buy any extra cars, period. Other than those 11 or however many that we got that first year, we couldn't replace them any other time if we, over the next couple of years. We could get out of it within 36 months. We could probably break even somewhere around there.
Well, based on the data here, as you see from Lincolnton, you're equitable out the door. So and if you look through
I
any
like
of our
worst case
contracts,
scenarios, not best case
okay,
scenarios.
so worst case scenario, you break even at 12 months on these vehicles. You're not held, the only obligation you have on an equity lease is to satisfy the unpaid principal at any time. That can
Okay.
be done through resale, that can be done through paying them off. The very worst case scenario, you get these 11 vehicles, it doesn't work out, you finance them all the way down to zero, take title, and then you run them 24 years again. But the fact that,
Add to that question, we have $70,000 in capital budget. Place 2 vehicles a year. Have that as placeholder for the 5 years. Place 10 vehicles, that same $70,000 that we place 11 for right now. Have all 11 life of those 5 years, if we even extend. Rather than 2 this year, 2 next year, 2 next year.
No, I mean, I get it.
If the same 70 says we can put 11 to work right now, or we can do 2 at a time for 5 years only. And the potential benefit accrues itself later, as Jack said. I mean, he's sharing us real numbers, but we all know that that'll be what we see actually happens. Whether we do the 36 or we send that out. But our goal is to say, get the $70,000 placeholder here that's going to take us. If we just left that $70,000 in capital over the next 5 years, and didn't change any dollar figure, we would end up with 10 vehicles, 8 of which would be more than a year old by the time we got to that, rather than have an opportunity to put 11 on the road right now for that period of time with that same $70,000 where we don't have another dollar.
Yes, but I think one point that Blair is trying to make is once we get into this, if you get into this 70,000, you're going to have to continue the lease. You won't unless you add to the budget for additional vehicles.
Right.
Yes.
Our capital budget's typically $1 million, right? That's generally what we've gotten over the last few years, and it's fluctuated here and there. And that's for all your roofs, all your paving, all your everything, right? Slap it in $1 million, and we all know how that looks when we finally get down to it. So if we get into this, right, for the next 3 years minimum, $70,000 in your transportation budget, almost 10% of what we have in capital is right there in those vehicles. So let's say we dive deeper into this and we replace our fleet, which I know that we need to do, but we replace our fleet. What is the bottom line dollar? How much are we going to spend on a capital needs budget if we went with a full replacement of our fleet to the 54 from the 73 that we have?
through this program.
Through this program.
Well, that would be a big capital increase every year to do that.
And that's my point,
in this
exactly.
point. And part of the reason we got into this, is I think we've gotten to where we have so much need right now. We needed something to sort of jump our capital for vehicles. Fred has sort of Frankensteined a couple of vehicles together this year for staff and students to ride around in that didn't end up being in the capital budget. So we needed a couple of vehicles there. That's where the cars come in. And this also gives us the maintenance vehicles. So if we could get a few more this year and then spend the same every year, at least in this window. And then hopefully, whether we can continue the program at that point, we would decide, or at least we've started our program to replace the vehicles. And then we go back to the way we were before, but at least for 3 years, we had enough newer vehicles in. I don't necessarily say that we should be doing this forevermore. Just to get us started, we needed something to boost us, and this program kind of fit that to a T.
Okay.
So I
Hey,
have
Bart.
a question. Oh, sorry, Jay. Go ahead.
Barney, so if we lease these 11 vehicles, we have I hate to keep repeating this. I think we keep talking about this. If we lease 11 vehicles, we've spent 70 grand, correct?
This year.
Yes, that's correct. And that is just over 70, and that includes all maintenance on those 11 vehicles for that lease term.
Except for tires. And
Okay.
Except for
And
tires and
then
brakes. Yes, sir.
next year, we can't do anything with any of the vehicles. We still have 70 grand tied up in these 11 leased. And
Yes.
the next
Correct.
we can't
Yes.
do anything over and above. 'Cause
What they're saying, it's an open-ended lease, so we can get out of it at any point in time, correct? So we could buy them and have them for a month, and we could flip them if that was the business that
Well,
we were
I
in.
heard that, but then he said the break even was 12 months. I'm in the car business. I don't see how anybody could be break even in 12 months, even for what you bought it for, the price you pay. I mean, are we buying these that cheap that we can break even in 12 months?
So the reason why this program works, Mr. Egoff, is that the government entities can buy vehicles less than what the market demands for them off the lot. So just because you're buying them for less doesn't mean that vehicle is worth less.
Oh,
And
sure.
when you combine that fact with the low miles that you guys operate these vehicles, along with every other government entity, your average construction company that's buying a truck to do this same operation is going 20 to 25,000 miles a year. With you guys going somewhere between 5 and 10, the vehicle is losing value much slower than all the other trucks in that class are losing that value. So that is why combine the incentive, combine the low buy that you guys have and the low annual miles that you drive allows for that break even. But yes, sir, that vehicle will be break. And you can see right here on this Lincolnton testimonial, some of those vehicles have been in service for 34 months and we still sold them for more than what the original delivered price was.
Okay, so I have a question I think is
Sure.
pretty important. Have you checked into insurance? Because I know insuring a vehicle that's 10, 20 years old is a lot cheaper than 11 brand new ones.
I believe Bernie said he had gone there.
Yeah, it for our fleet, it will not be a significant increase to insurance costs according to our insurance company. Just because of the way that our overall coverage is built, we incorporate all of our vehicles, a lot of our equipment into one big policy. So they sort of collectively say, yeah, we are going to cover X amount of dollars for you guys. It's similar with our buildings. The same thing goes into place that everything is built into one bigger coverage policy.
It's just a huge umbrella policy.
Yeah. So while this would change the value, it's not a substantial change in value for what they cover in our premiums.
Bernie, what do we have to lose with this?
Funny.
Yeah, it is. It is a cash decision of that if we get into a program that does not benefit us, that would be the down the road, that would be our problem. If we then had vehicles that we had to sell to make the money back. I don't think I think it's a very low risk possibility that would be the risk.
I think there's also the risk of students and people being in unsafe vehicles though, and they're aging out, as you said, and maintenance costs are just going to get higher and higher. So I think we have to look at worst case scenario if we don't do something like this as well. I mean, those maintenance costs each year are pretty high on the slide before.
What does the maintenance actually cover from your end?
So the maintenance on the new vehicles will cover everything with the exception of brakes and tires. We have the ability to include brakes and tires in, but with the low miles that you guys are driving, my recommendation would be to only pay for those if you need them.
And how do you service that? Do you come into our shop or are we dropping that off or how does that work?
So my understanding is most of the maintenance is outsourced today. So we have local shops that are either mom and pops, franchise dealerships, local dealerships, national accounts that are all on the enterprise program. They would essentially go in, show the mobile app or maintenance card, and then the driver is done at that point. Our national service department negotiates parts and labor, make sure that what's being done actually needs to be done. And then when you guys go, and this is something we hadn't talked about yet, but you'll have a dashboard and the school system will be able to use, and your full maintenance repair history will be there. All of your spends, anything that we can capture from a data standpoint will be viewable for you all. And that's one of the big things is, yeah, if you try it for a year, every single year we come back out with an annual client review. And it's typically during budget season so that we can show, here's what you were spending before, here's what it looks like now. So you have all that data to say, yeah, this was a great decision and we're saving money, we're saving time, everything's great, or it wasn't. And if it's not, the way that we set these up, you can get out of them. You're not held to these leases for a certain amount of time. You can get in and out of these leases fluidly as you need. And maybe one vehicle isn't for the right spec and you need to trade it out for another one. You've got the ability to do that because of the way that we conservatively set the leases up on the front end.
And we did check with Martin as to what service companies he's using around town, and they do participate in this program. So wherever they're currently going, it would continue to go to, and it would just be part of this plan. They wouldn't have to switch garages or anything.
The thing that bothers me about this is if we decide in 2 years, this isn't what we wanted, it's not feasible for us, that's 4 vehicles we could have paid cash for and had, in the end of 2 years, we're just out. It's just money gone.
If that were the case, we would then most likely sell some of the vehicles, which would actually make us the cash back to then buy out the ones that we would have kept, that we would have bought anyway in the program.
Well, that's fine, but we keep assuming that all these vehicles are going to be worth more. And I heard 3 years saying that the vehicles sold for more than the first paid for. I just don't, I've been in the car business since 70. I've never seen a 3-year-old car sell for more than it was originally sold for. I don't think that's possible. Unless it's some, Aston Martin with 0 miles. Like a collector's edition or something. I've never seen a car or truck sell for more than it was originally priced 3 years later. Never.
I think the government discounts is what you're
Yes, ma'am.
about to say,
Yes,
right?
ma'am. And then the only thing I'll say to that as well is I'd be happy to provide the reference for City of Lincoln. You guys can reach out and speak on. I know Dr. Bryant spoke to Hendersonville. We work with Laurel Park and several other local entities around here.
Well, how many cars does Laurel Park have?
Just over 20 in total.
Yeah, 20 cars.
And we do services for their public works and their police department.
I will say this, what we're spending right now is not enough. That's why we're in this predicament. And it's only going to get worse. We can't look at keeping the budget at 70,000 because eventually, we're going to be spending more. And, I would be okay with doing this to start with, to see. I don't know if we need 11, but y'all. But what we're spending now has put us in this predicament.
Yeah, it's almost 10% of our capital budget. I think it's the predicament of every school system in the nation is you have to pick and choose which roof and which car you're going to replace at which time.
Yeah.
And it's a never-ending battle. And we're how many times we whittle down the budgets and whittle them down and change this and move this around and it's just really difficult right now in this day and age for me to be like, hey, let's go ahead and just start flipping, 11 or 54 cars, because it's a lot of money.
Yeah.
But, if we could do this and you could show me in the budget where you could save us some money to where we could actually replace the fleet, programs that are outdated or money that we can save from here or there, I'm all for it. But if we're going to have to go ask the commissioners for another $1.50 to do this whole program over 5 years, ain't gonna happen. That's just not gonna happen.
Many of our cars have to be replaced in the next year.
73?
30.
We have the age of our fleet right now. Have real concern about how we're transporting.
Yeah.
I can't hear.
Oh, get on the mic somewhere.
I'm sorry, Mr. Egolf, I was kind of backing up your point about whatever it is, it's not enough, right? If we replace vehicles 1 or 2 or 3 a year even, let's just say we left it as a placeholder, we sort of never catch up, right, at the size of our fleet. The impetus behind this was we had a real need to replace a series of vehicles, which we've been working with Chad on, and we do recognize that the equity in sale that captures that total capital spend will only be proven when we actually do it the first time, right? So when we talk about should we go down this road, Mr. Sosha has been long asking us to give this consideration for years now, because capital, if we keep purchasing at the rate that we're doing, we just never catching up. We will never catch up with the need. So when we look at this particular thing, we recognize we needed a partner who can do this work and then make a determination as to do we see it come to fruition. But to answer your question a little more shortly, like we have needs across our entire fleet. And when we talk about the safe transportation of our students, the safe travel and service of our maintenance staff, it's imperative that we do that. We had budgeted that $70,000 for a reason, to make those purchases. We recognize it presented us an opportunity. But we want any decision the board makes to be a decision you feel good about. That wasn't the punchline.
Listen, there's lots of decisions I don't feel like great about.
Yes, sir. No, I understand.
There's a lot of decisions.
I understand.
I'm not going to feel great about this. And the thing is, the proof's in the pudding, like you said, a couple years down the road. But who knows?
So to make sure I understand this correctly, in however many years that you're saying, whether it's 3 years, we would sell these 11,
We would have the option to do that.
Yes, ma'am.
but like to make like that 105,
Yes, ma'am.
and then, but we would still need that 11 plus 11 more at that point, right?
Right. I'm sorry.
So what
If I can
happens
speak
if
to-
what happens if we say, okay, we're not going to sell them, we want to keep them, we just have to buy it
You pay the
out?
payments or buy it out.
So what we would do is you would just essentially extend out the lease. So that's what I was going to mention to your last point, is if we get to the end of this term and you want to keep them, you can extend them out 12 more months and own the vehicle again. Title gets transferred back to you. You go back to what you're doing today.
4 years.
We have the ability to do anywhere between 12 and 60 months. So on the
Okay.
long end of it, we would do 60 months.
Well, what's the residual that's going to be left on these? So how many years worth of residual would be left on these
So-
11 vehicles,
What we put on this right here is we've got 36 months on each of these.
right?
And what
So
you
the
can-
unpaid terms are over there on the right side.
Yep, so you've got the residual versus what they'll be worth estimate wise in 36 months on the right side.
So that's what those cars are worth. And then how much is that going to cost us to pay those off if we decide to pay those off, Bernie? Like, what would we need to do? What's that payment? How much are we spending at that point? You see what I'm asking? On the very far, unpaid principal at term, that's what we would owe on these vehicles at the end of 36 months, right? Somehow, like Jay said, the value's still higher than the term, but if we decide to keep those vehicles, we have to pay off that balance, 18, 18, 18, 18, 10, 16, 16, 11, 6, 6, 6, 6.
You wouldn't necessarily have to pay it off. You could extend it out. Again, that's what we're doing is the only thing that we're looking to change is today you're paying cash for an asset that's never worth what it is off the lot when you drive it off.
Sure.
You're writing that check, and yes, you're running it long enough to fully get that depreciation, right?
Sure.
But all we're saying to do is implement two things: cash flow on acquisition, and you have all the flexibility. You can get in and out of vehicles. You can extend them. You can short cycle
We
them.
don't like to get out of them. Do you not know that? 20 years is a good
Right.
number.
But if you decided
It's
to,
by
right?
our fleet.
Ay, ay, ay.
But it's really just that. It's implementing a cash flow model that gives you flexibility to make decisions as a school system that are going to be best for your fleet, and it pairs that with proactive resale. So those are the only two things that we're really looking to change. You're shifting from paying cash to cash flow, and you're shifting from holding vehicles until they die, and like you said, maybe Frankenstein one or two to keep them going, to selling them at the right time, to where you can, and again, I know it's an extreme situation where you would sell them for more than what you bought them for. That happens from time to time, but at the end of the day, you're going to sell them for more than what you owe on them, and there's always going to be that equity that helps offset the cost of the program. All this has given you guys is the ability to replace more vehicles in the fleet without taking on the additional capital burden, and the flexibility to get in and out of them through resale, through short cycling, through extensions of the leases. Our goal is not to stick you with a hefty bill at the end of a lease term.
Right.
And I don't think 50 to 60 other government entities in the state wouldn't have partnered with us if we're doing that.
I think the point is, though, the cash flow that you speak of is only year one. That's it.
Not necessarily.
Well, it's on those 11 vehicles, but we still have 50 or 43 that we would need to
Gotta
replace,
do
right?
those.
Well, how much would it cost? How much would it cost you to go pay cash for those 11
Well,
vehicles?
we're not going to do them all at once.
Right.
We do them two at a time.
And then that's what happens if you don't do that. Then you never
That's
catch
why
up.
we own
Yeah.
If we
20-year-old
only go
vehicles.
7,500 miles on a car, why the hell we need to replace them every 15, 20 years?
For the exact reasons that you're seeing now, increased maintenance expenses, safety concerns. When looking at the fleet, you guys have a sizable number of vans that if you were to go and try and buy that vehicle today, don't meet government regulated safety regulations. Things like electronic, they have seat belts, maybe, but things like electronic stability controls, tire pressure monitoring systems, all these things that have been mandated, you know, years and years after the vehicles that you guys have in fleet today. So again, I'm not trying to fundamentally change anything you guys are doing. My goal is to be here, to be an ally, to be a partner, and give you the resources and the data to make the best decisions as a fleet moving forward. And we're not sticking you with, I would never want to do that to anyone, much less try and do that to a school system or anyone else. We're trying to help you guys use your money to the best of your ability and keep your staff and your students safe when they're being
And I
transported.
appreciate that. I think the thing is, it's not our money. It's money that we get from another government entity.
Sure.
And that can fluctuate at any point in time.
Hey,
And
let me
cash flow today is not necessarily our cash flow tomorrow.
When you look at the city of Lincolnton resale results, how do they resell these vehicles? What is this a reflection of?
That auction,
Auction?
So Enterprise sells those vehicles on their behalf, and we have a range of different sales channels that we utilize. So if you think about Enterprise Rent-A-Car, we sell over 1 million vehicles a year on Enterprise Rent-A-Car, and we sell these vehicles through the same channels that we sell Enterprise's vehicles through. So whether it be auction, whether it be direct to dealer, wholesaling, however, whatever is going to command the highest resale dollar for you all is the way that we're going to sell them. So these are not, you know, just use a public auction, whatever the case may be. We're taking these and we're marketing them on your behalf to drive the resale dollars on the back end, because that's only going to help you when we reinvest in the fleet.
how do you guys get paid?
So the money that we make, there's 3 different ways. On the front end, when we order a vehicle through the manufacturer, the behind invoice monies that would typically go to any dealership that sold that vehicle, Enterprise gets that. Majority of money that we make is going to be in our management fee, which is included in the lease. So basically 0.1% of the delivered cost of the vehicle is part of the monthly payment. And essentially what that does is that goes to give you all of our infrastructure, our resources, everything that we offer within that. And then on the back end, when we go to sell a vehicle for you, it costs us $395 to essentially do that transaction. Transfer the title to the new owner, handle the marketing on it. So those are essentially the 3 areas that are
So
considered.
you keep all the rebates up front, you charge us 1.2% per year, and then you are charging us a dealer fee to sell the things when they're done.
So we do not keep the rebates. The rebates go up.
Rebates go to lower the price of it.
So the rebates, the government incentives are due to you all. We don't touch those. These are credits that anybody who sells a vehicle would get those credits. They're not destined to affect the price of the vehicle. They are given to anyone who sells, whether it be a dealership, whoever, another fleet management company.
Bernie, how much is the 11 we have now going to be worth if we sell them, if we go with this program?
You won't know.
$58,000.
You don't know till you sell them, when you sell them, if you sell them.
Well, a ballpark figure.
We estimated that at you're talking about the current
Ones
fleet?
we have now.
We estimated that
It
at
was
$1,000 per
$1,000,
vehicle.
so 11 grand.
$11,000.
Well, the front of this page there is a motion, and someone can make a motion if they like, or they can table this action.
Hey, one more question. I know
You can ask as many as you want.
one more question. I know you're going to have a money factor on each vehicle that's different. Isn't that? Are you agreeing with that statement?
What do you mean by a money factor?
Interest rate.
Your interest rate is going to be fixed at the time of delivery, and it's per the Sourcewell agreement for the state. So essentially, it's T-bill plus 350 basis points. And it doesn't matter what vehicle it's on, it doesn't change at all. It's going to be fixed at the time of delivery.
Do you have an example of that on you?
No, sir, but I mean, we can provide the Sourcewell agreement that spells out the pricing plan.
Okay.
It's T-bill plus 350 bips.
Okay.
That's still cheap.
Yeah.
So may I ask a critical question for me? Dr. Bryant, is this what you feel like we need to do in the best interest of our school system? And Bernie, do you concur with it?
My answer is yes.
And we will have our attorney look over the lease to make sure we have that out if we so want it, correct? Then I make a motion, or I move the Henderson County Board of Public Education approve the engagement of the enterprise fleet management as presented.
Do I have a second?
I would second that.
Do we have any discussion?
You're 100% sure with the insurance? We're going from 1990 vehicles to 2021 or whatever, and it's not going to go up.
It's gonna go up a little bit, but not significantly, and it will go up less than what anticipate our costs are going to save.
And do y'all, you want to go with 11 and not a smaller amount to start with?
Yeah, the motion that was on the table is what's read in front of us, and it's essentially replacing the 11 oldest vehicles. Now, it does have some weird language at the bottom there, the last sentence. Enterprises, resale channels, and selling units is oftentimes can implement a 5-year vehicle cycle in which all units remain under warranty. So that's a good question. What is the motion that you're making, Dr. Revis? Is that to replace the 11 vehicles?
I assume it was, yes.
Yes.
Okay. Yes, sir, Jay.
Thank you.
All right, there's no further discussion. Ms. Case?
I agree.
Ms. Holt?
I mean, the only way we're going to know is to do it. You're sure about the insurance? We just replaced like a bunch of vehicles, and that's why I keep saying that. I mean, we don't have 70, but we have like 25.
He wants to talk to you next.
This list of vehicles, we'll be asking if we have a couple of these on here this year. The next vehicles are gonna be next year's capital request, and the next year's a 3-year out cap. This is what Martin has said. These are the next 5 years worth of vehicles that we're gonna replace,
Okay.
whether we do it this way or come each year.
I'm a yes.
Ms. Caskey?
Yes.
Mr. Bridges?
Yes.
Dr. Revis?
Yes.
Mr. Egoff?
Yeah, the only thing is, I go back to what I was saying before, we are not spending enough to maintain
I
our
agree.
fleet. And so if we're going through this and we find that we're going, we went backwards and we're spending more money, it doesn't matter if we said no to this, and in years to come, we're going to have to spend more money anyway. We're not spending enough money to maintain our fleet, so we might as well try it this way to see if it saves us more. But we're going to have to be spending a whole lot more than what we are currently to maintain our fleet. That's all I'm saying.
Was that a yes or a no?
Yeah, yes.
I agree with him.
And I am a no. Thank you. It's approved.
I really appreciate the time. Thank you for the opportunity.
Bernie, can you make a note of that when budget comes back up, that we talk about our fleet a little bit more and where we can borrow from Peter to pay Paul?
All right, let's, we got a couple things to kind of plow through here. This first one's pretty easy. Dr. Jan King, 2 hours and 15 minutes later, your turn.
I'll take the easy softball, right? Anytime we spend federal funds in excess of $10,000, it requires a bid process. There is an exception to that, and that is if it's from a sole source vendor that we can both get approved by the Department of Public Instruction and the local board. We anticipate, but to my knowledge have not received yet, Mr. Sushik can correct me if I'm wrong, last week they weren't here, some funds that are specific to COVID relief and intended to be spent on digital curriculum. And as we have looked at a need in the system, as we are having, of course, about 30% of our students on remote learning and students right now in grades 4 through 12 hybrid, is ELA. All of our literature resources are have copyright on them. And so to be able to put literature passages into Google Classroom is a challenge when it comes to copyright. And we have found a vendor, Newsella, who can provide that for us, grades 2 through 13. It comes with differentiated reading levels at 5 levels. And so the Department of Public Instruction approved recently our sole source request, and we're coming tonight to ask you that when those funds arrive, we would like to invest them in Newsella so that it would benefit elementary, middle, and high school learners in English language arts classes across the district. Be happy to answer any questions.
All right. Questions? I'll take a motion.
I move that Harrison County Board of Public Education approve Musella as a vendor under the sole source exemption guidelines.
Do I have a second?
Second.
All right. Ms. Case.
Yes.
Sorry. I hate doing this. Ms. Holt,
Yes.
Ms. Caskey,
Yes.
Ms. Bridges, Dr.
Yes.
Revis,
Yes.
Jay Egoff,
Yes.
and I'm a yes. Thank you. Next up is going to be Dr. Bryant.
Yes, sir. Thank you, Mr. Chairman, members of the board. What you'll see in front of you is a summary of requests as it relates to an appointment on behalf of the Henderson County Board of Education for a slot to serve on the Board of Trustees at Blue Ridge Community College. As each of you know, we have a long-standing, really healthy relationship with the community college, articulation support for our students and for our staff. And we're fortunate enough to have had Dr. Kathy Revis, who has been serving as one of those appointed Board of Trustees members. Upon her election to the Board of Public Education, she resigned her position with the Board of Trustees, which created a vacated spot that this board has the ability to make an appointment for. What you see in front of you is a recommendation to submit that request on behalf of Ms. Kathy Childress to serve in that vacated slot. Kathy Childress has been an employee of Henderson County Public Schools. She is a longtime educator, an employee of Transylvania Public School System. She understands both the environments that Blue Ridge Community College serves. She is a champion and advocate for education, just as Dr. Revis has been. And it's certainly our belief that she would be a wonderful representative to represent the Henderson County Board of Public Education on that vacated spot.
Yeah. Any questions about Miss Kathy Childress? She was my principal, and she was awesome. I love Miss Childress. If there's no other questions, I'll take a motion.
I move that the Henderson County Board of Public Education approve the request to appoint Ms. Kathy Childress to the Blue Ridge Community College Board of Trustees.
I second.
Great. Ms. Casey,
Yes.
Mrs. Holt,
Yes.
Ms. Caskey,
Yes.
Mr. Bridges, Dr. Revis,
Yes.
Mr. Egoff,
Yes.
and I'm a yes as well. Thank you. All right, let's move on to the Dogwood Health Trust and Eye Cares grant. This is really cool.
Yes, sir. Thank you very much, Mr. Craven. And members of the board, as you see here, we are fortunate to be bragging a little bit. I'm going to ask Dr. King to step up to the mic. We have, through her exceptional work in the partner agencies that she is well connected with, but also her instructional services team, who really create the fabric of that partnership. We are fortunate enough to be announcing grant awards from Dogwood Health Trust, which is considerable, and Eye Cares grant funds that are going to be utilized to support our students at this current time and moving forward. And so Dr. King will share a little bit more about that.
I feel like we need a band and some drum roll because this is good news. We love grant funds that help support our students. First, I'll talk about the Dogwood Health Grant. We are so excited to announce that we are the recipients of $225,000 to support Hispanic and multilingual students during outside of school time from remote learning. And so we're going to be able to expand partnerships, expand services, and that is very, very exciting. So again, $225,000 coming from the Dogwood Health Trust to support Hispanic and multilingual students. Then secondly, the Eye Cares grant, we just found out about this recently. 13 of these were competitive grant funds also. 13 of these were awarded in the state through a partnership with the Boys and Girls Club, who we have a long-standing partnership with. They already address lots of learning encouragement, and they have a well-set program there and serve lots of our students. $350,000 to serve more students, to expand services, again, for after school, evening, and summer remote learning time. And so we are so excited about that. Have to give a shout out to Julia Hockenberry and the entire Boys and Girls Club staff, their hard work. This was an idea. It was a big idea. And as we met last Friday after hearing about the grant, we were saying, this is so exciting. We have so much work to do. But it's great for our kids. So those two grants together, we're so excited about to be able to, $500,000 to come in and support the students of Henderson County Public Schools.
Thank you so much.
Goes without saying again, that does not happen without what Dr. King does, without what her team does, and all the many partner agencies that we have in the community. And she talked about the Boys and Girls Club. They are a huge partner of ours when it comes to the work that happens there. And so kudos to Dr. King and her team for the work that's done there.
It's wrestling time.
It is wrestling time. I'm going to ask Mr. Rhodes to come on down. The construction update is simply this.
Oh.
Again, if you've not driven by Hendersonville High School as of
Sorry.
late, it is the most visible construction work going on. But again, that work continues to progress aggressively. We look forward to a time real soon where perhaps one of our school visits can be an opportunity to walk through the work that's happening there. And so I invite you guys to, again, drive by if you've not done so recently. But as you see the brick going on the outside, it's a pretty exciting time. Yes, ma'am.
The back of the new old gym now, the main gym,
Yeah.
the white part, were we going to paint that gray?
You know, it's getting paling, right?
No, it's getting painted. It's a particular substance that is, it's not paint itself, but it is being covered and sealed, associated, and then that's where the logo bear
For
claw.
the
Bear
paw,
claw.
Bear
right?
claw
Okay.
will be. Yes,
I
ma'am.
thought, I mean, I knew they wouldn't do that now, but I couldn't
I
remember.
thought we were putting some type of paneling.
That was one of the initial recommendations for putting on the outside, but it was cost prohibitive for the total
Yeah,
of the
I think they were
project.
like,
Right.
I can't afford it.
Okay.
But the
Like thick paint.
yeah. Well, what I can tell you is it's going to be pretty awesome when you think about the logo
Yeah.
of the school.
That's gonna be cool. 'Cause
Visual coming down 25. It's going to be pretty awesome.
Yeah.
So, continue to see that work going on. I'll turn it over to Mr. Rhodes in wrestling.
wrestling.
Ric Flair himself. Here is,
I'm sorry.
Thank you, members of the board. I appreciate the opportunity to speak to you this evening about athletics and our return to athletics. And get started by just updating our new board members just where we're at athletically with our sports calendars. To start with, currently we are right now in the middle of our volleyball season. That started November 4th. We have been playing since the 16th of November, and we have been doing that with success. So we're really excited about our student athletes having that opportunity to participate. And also, right now, we started November 23rd with our first contest was December 7th. We have swimming and diving. We don't have any diving, but we do have swimming. And 2 schools are participating in that right now. We also have basketball season just started on December the 7th. And if you've heard that basketball players are having to wear a mask while they play basketball, that is true. Hard to believe, but yet it is true. And we will accept that because we still want our student athletes to have the opportunity to participate, and it's better than the other option. So we are excited about that, with the first contest being January the 4th, with the number again, 14 contests. Fan participation is limited at this time. We are only allowing home fans at our athletic contest. That is consistent throughout the mountains of Western North Carolina and across the state. Anything that's happening outside, whether it be football, or soccer, those events would allow 100 people to attend. And right now, our inside sporting events will allow 25. We are using a system right now. I don't have this up here for you, but we're doing a touchless ticket system for our high schools. You buy a ticket online, you walk up, you just show your cell phone, they scan it, you get in the door. In our middle schools, they are pre-selling those tickets so that there's not any exchange between the people who are attending the athletic contest and the people that are working. We're also really excited about our live streaming. You know, we have only allowing 25 people. We still have a lot of people who want opportunities to see those athletic contests. We have fans who are for the visiting teams that can't come. And so we're able to live stream right now using the NFHS network. So we're live streaming using a system called Pixelot. We're really excited about that. Those systems are up again in all of our gyms and our high schools. And our middle schools right now are using a YouTube live stream.
And so that is also available. When I back up and I go to just the live streaming with the Pixelot, there is a subscription cost of $10.99 a month, or you can also buy that for a year. The YouTube live stream is free. And so anyone who's interested can go on to the individual school website. You'll see an icon down in the middle of the page. You click on it, and then you will be able to get to this information.
How are we selling those to visitors?
So we don't sell those. The anyone who is at, like, for example, there's other schools who have the Pixelot systems. In this case, like TC Robertson and a few other schools, anyone who has a subscription can watch any of those individual contests. And the way that works for us right now, we're on a 3-year program where we don't share any of the subscription costs. The company, NFHS, they get all that subscription money. In turn, we got those systems for free. And that is anywhere between, could be $3,000 to $5,000 per system. We've got 2 at each school, one on the football stadium and one in the gymnasium. We kind of got lucky and got those systems before COVID hit and before there was an uptick in people wanting to live stream events. So so one of the things that we have talked about is selling ad packages through the Pixelot system, because the Pixelot system does give us an opportunity. It's like live TV. And so with live TV, you have an opportunity to sell some ad packages. And that's where our schools have an opportunity to earn money. Well, this year, because we are looking at experiencing a downturn in fan attendance, we're also looking at, and you'll see at the end of the slide, where officiating costs. The board had asked us to bring them a number of what that may look like if the board decided that was something they wanted to do to try to help out our schools. So one of the things we also talked about was selling an ad package to offset that cost. And so I'm going to go over those with you real quick. Our first package is the District Champ package. This is only for one company, one business, and we're going to actually let folks bid on this one package. Right now, it's no less than $5,000, but I got to be honest with you. I'm in the education business. I'm not in the ad selling business. So it may, what I believe it to be worth $5,000, it may be worth a lot more to someone else. So we want to give anyone, an individual within our community who has a business, if they want to, it may be worth more than $5,000 for them, but at the very least, it will sell for at least $5,000. And so what does that person get? Well, that package includes a 30-second mid-roll video commercial during the game. It also allows first position for the presenting sponsor. It's a graphic carousel ad that's on all the network pages. And folks, this is for every game that we have for every school within our school system. It's almost 185 to 200 contests that people will have an opportunity to have their ads up, okay, for this one business. It's also a watermark graphic on all games and all schools. And then again, we have one per district. Then we're going to be selling, again, the athletics MV package. It could be for like the West Henderson. It could be the West Henderson Athletics MVP package. It's a cost of $1,500, and this package includes a 15-second pre-roll video commercial before games, a second position carousel ad on the school page, and I'll show you an example of all this in a moment, watermark ad on all home games throughout the season, and there's one per school that's available for here as well. A school-sponsored carousel ad package, a cost of $1,000. What does this include? Each school network page may host up to 6 rotating carousel images with a call to action link to the sponsor's website. Okay, and this right here is 4 per school. And then last but not least, we have a $500 package. Sponsor receives an ad space in every game with their logo in the corner of the screen. And then we also have one available school for per school. So if you're wondering, like, how much money could we raise through this? Okay. Again, I'll go back to, I'll use Dr. Bryant's line. I'm not a PE teacher. I mean, I am a PE teacher, not a math teacher. But I think my math's pretty good. And I think, well, you know, thank you. So anyway, right now, what we're looking at is $24,000. And then with the $5,000 additional for the MVP package, that could go up to $29,000. And if it sells for more than 5, then that would be whatever that number is. Mr. Rhodes, would you just share a little bit more with them about how Ms. Molly McGowan, of course, should be sending information out to people who might be interested in the district package? Yeah, that's up next right here. So what we're going to do with the MVP package is making sure that you heard this first here this evening. Tomorrow, this information is going to go out through our social media platforms. Okay. So we're going to go ahead and get this information out. People within our community who are interested, go ahead and start sending in information. We're going to take advertising packages bidders. We're going to take bids through January the 1st. By January the 6th, we're going to go ahead and reward this ad package to one of our local folks in our community. Now, we do run the risk that some people may bid this exact same amount. And if we do, we'll call those people together, be very transparent about that process moving forward.
So it's gonna, the cost is $5,000, but you're gonna bid and try to get more for that?
So we're going to allow individual companies to bid more if they choose to.
Okay.
So if someone says, you know what, it's worth more than $5,000 to us, I'm willing to bid $10,000 for it. Well, then that's great. Again, I go back to the thing I said at the very beginning. We believe that this is worth no less than $5,000 to an individual company or business.
That's
But someone else
$25
may
a
think,
game.
huh?
It's $25 a game.
Sure.
I mean,
Why can't we sell more than what you got up here?
Well, we just decided that based off of the information that we got from Pixelot and how that system works, we only have the availability for one. It doesn't allow us to sell more. And because there are some things, again, when you schedule these, just so we're being very transparent, they schedule for a time. So there's not someone sitting there, like in a booth, like on a regular televised game, if someone is doing that. So that's going to be scheduled to go out at a certain time. So we want to make sure that certain time is not like at the very last. We want it to go in at close to halftime.
Right.
We don't want it to go out with a last second shot getting ready to go up for the buzzer and all of a sudden, whatever company. I won't use any examples because we have people in the room who own companies, but you can figure that out for yourself. Okay. So that's what we want to avoid.
So is the bid going to be public? Can we see the bids and outbid each other? Or it's going to all be private?
I think we don't want those to be private.
When's your final date going to be?
January 1st is when everything's due, and January 6th we'll let the person or persons know if we have multiple bids that are the same, what the process would be moving forward. But we hope to name someone January 6th.
Your school-specific ones are first come, first served?
Mm-hmm. Yes, sir.
Are there going to be any businesses that you do not want sponsored on here, and who's going to make that determination?
So we haven't had that discussion about any business that we would not want to allow to be on there. But that if something were to pop up of a business that we were concerned about, we would definitely have conversations before going down that road.
I want to ask the attorney, is it a conflict of interest for someone that owns a business to bid on this? A board member that owns a business, can I bid on this? I can have my marketing person bid on it, so it's not me. But it will still be my company.
Can I look at that?
Yeah.
I mean, I don't think it's any different than buying the little signs that you stick on the outfield of the baseball fields, I mean,
Yeah, we support all the schools and do all that, but I just want to be sure
But it's so competitive.
before I
as long as
outbid
it's a
Jay.
competitive.
How much you bid, Nate?
I'm outbidding you.
What?
I said before I outbid you, I want to make sure I can get it.
You can't.
And you-
An e-golf can.
All right, let's show that next ad, and then let's talk about what this money's going to go to, and what we need to support our athletes for the rest of the year.
Okay. So again, this is just an example of what may look like on the screen for the ad packages. And again, another example. So one of the projected costs that we talked about in our previous board meeting was the cost for officials. And again, one of the things that we are most concerned about is the loss of ticket revenue, especially in those football and basketball. We look at that as a situation where our schools that are a huge disadvantage. So Mr. Craven asked for us to come back with a hard number of what that was going to cost, and based off of high school and middle school numbers and what it costs for each individual sport and the officials, we've come up with a number of $86,510.
Big number.
It is a big number. And again, that number may go down because, again, some of the officiating, so for example, like baseball, softball,
normally you have two officials, two umpires. Folks, we're having a hard time getting enough officials to be able to call those games. So there may be situations where there's only one, and so that cost could go down. But this is the worst case scenario right here is $86,510. Again, depending on how the North Carolina High School Athletic Association, as we continue to move forward, we anticipate that we're going to play all the way through the spring. But if something changes, then we would make adjustments to that as well. And so, if you decide to approve, one thing that we can do is we can allow our schools to continue to pay for those officials. In each one of those accounts, that number would show up in the red, but they have enough money at their school and their school accounts to be able to pay for that officiating cost. And at the very end, if you decide that you want to make those schools whole, then that's a possibility that you could choose to do.
When we talked about this, I don't know what it was last month, month before, we've got about $400,000 in monies that we set aside to start this budget year for unknowns. This is clearly an unknown, right? And to me, I know for me, when I was in school, sports were everything. And I couldn't imagine not being able to play because we couldn't afford to pay a referee, right? And that's kind of where we're at with our individual schools. And so I'm of the opinion that we should take money from that. We should separate 86,510 from our CARES money, or what do we call that? $400,000? What are we calling it?
It was a CARES Act money.
CARES Act. It wasn't CARES Act money.
Mhm.
It was.
No, it's just local undesignated.
It was
funds.
local
Yes, sir.
undesignated. You take that $400,000 or $85,000, and put that to the side to pay for this. Whatever revenue we receive from the ads, put it towards this cost, and then we make those schools whole at the end.
But what else do we need that money for, John?
As Mr. Craven said, all the things we don't know about. And so I think what we have to be able to do is we can put a placeholder there, but any of that remaining money would be money that we would come back to this board because it would not be encumbered or directed toward any cost until we presented to you those unknowns. So as we move forward the year, we're halfway through. We've designated none of it. And this is an opportunity to consider how that might be
Are we
used.
gonna have to start paying for feeding kids?
Not at this time, we're not. No, ma'am.
So when we did the budget last year, essentially Bo had identified, Mr. Caldwell had identified, I think it was 13 positions that we potentially might need to hire, but then we were able to use it through CARES Act. And then there were some extra dollars that were sitting there. And so that's why we just lumped it up as that 400,000, and we haven't touched it.
Yeah, but we put some things on the back burner, like the auditoriums and stuff too, that we said we'd go back to.
Well, we're not even allowed to use them right now, though.
But we will
It
eventually.
would, yeah. So that's my thoughts on it. Take the 86, put a placeholder on it. Let's sell some ads. See if we can recoup as much of the costs of paying for officials, and let's let our kids play some sports as much as they can.
Hey, Blair, I have one more question.
Yes.
When we say availability of one per school, how many schools are there?
4 high schools.
I'll go to the school board.
No middle grade. I mean, it's just the high school.
This is just for high school, yeah. This is not, because we're only using the YouTube for the middle school, so you can't sell the ad packages on there. This is just for our own pixel art system.
I didn't realize it was just the high school. I was just making sure.
Yeah.
Okay.
So the most we're going to make is 25,000, I guess, on this. Is that what you're anticipating?
I think somewhere between $25,000 and possibly $30,000. And I would also say that this is consistent with other school districts in Western North Carolina. This is not uncommon. Some of the other county athletic directors I've spoken with, their school boards have too chosen to help out in this manner with officiating costs.
You said get two of the same bids, like if you get two $6,000 bids, like you ordered which one?
So right now, Mr. Bridges, what we've discussed internally is that we would call those two businesses or companies and let them know, and that we would be just selecting someone randomly out of a hat.
Mr. Bridges, when you talk, would you please keep that microphone on and talk into it, because they can't record you and hear you. Thanks, sir. Gates, what are those gates that they're going to make? I know the gate's going to be very little.
Yeah, if I don't have that information in front of me, but I would just remind you again, those gate numbers that I brought to your attention last month, very minimal.
Yeah.
And especially when you start looking at the middle school numbers, that cost, it looked like it was going to be okay, but the reality, we're not going to have 100 people show up to a baseball game.
Right.
We're not going to have 100 people show up to a middle school softball game. So it's going to be a challenging year.
Here's a good grace.
All right. Any other questions or anybody disagree with not paying for officials or leaving money aside to pay for officials for the next 5 months?
Yeah, I mean, I think unless it's dire, like we need PPE,
Sure.
something like that, but absolutely, these kids need to be able to play.
You do? Thanks, sir.
Okay, thank you.
I guess you're next with the equity update.
Yeah, I think I get to stay here a couple more times.
All
Let me just go ahead and I'd love to give you just a little small equity update. From an HR standpoint, it's that time of season we get back after Christmas. We're excited that the recruiting season is going to begin. Last year, board members, we were planned to go to a number of universities out recruiting, but also to some of our historical Black college universities. So we are really being focused in HR of trying to hire people that look more like our students. And I got to be honest with you, it's very challenging because of where we live sometimes, because it's expensive to live here. But we have made a real effort, and we were signed up to go to Winston-Salem State, North Carolina A&T, had calls into Shaw Universities, a number of other programs. And so with that being said, just letting you know that recruiting season get ready to start. Winston-Salem State, we already had a small recruiting online virtually with them back in the fall. We're going to be doing that again with those folks at the spring, North Carolina A&T. And some of those folks have not scheduled their recruitment fairs at this time, but we will be getting that information when we get back in January and getting signed up for those recruiting visits that will be done virtually. Also, just want to let you know, we just renewed our subscription in the National Minority Update. It's America's #1 resource for diversity and employment and education. So we've renewed that subscription as well. Any questions?
Thank you. Chuck here.
Chalk here. So I want to give you a piece of good news. When we start talking about our operational grant money that we just received in November, we received $33,029. And so that money will be used to offset the balance right now of our child care program. And just to kind of update our other board members, we've had a lot of discussion, to say the least, some very passionate discussion at times about our child care program. And with that being said, I want to share some good news with you because it is Christmas time, and we did get $33,029. So that money will be put to good use again to offset that balance. So what can you expect moving forward? So I think it's really important that everyone understands that right now, myself, Dr. Bryant, Mr. Socia, we are working to inform all of our newly elected board members next month. We come back in January at our next meeting. We're going to inform you at a greater level about where we're at with our child care program, where we've been, where we're at, and where we're going. Okay? So we're going to present some options to you. I feel very confident about where we're moving in the direction of bringing you options to the board. We feel like that it is our responsibility to come up with a plan that you can support as we move forward with child care here in Henderson County. Or if you see that there needs to be an exit ramp for our child care program, we're going to give you options for that as well. But when we come back to you to meet with you in January, we will have a full presentation with a number of options for you as a board.
Thank you.
Thank you.
Why did you overhear me on that update?
You did good. Thank you.
Thanks.
And I appreciate that.
So, Joe. All right, Mr. Socia, financial statements.
Good evening again. Just one this evening, local current expense, other restricted funds. For those of you that are new, we do this every month. We do the local current expense unrestricted every month. And quarterly, we do capital and the enterprise funds. So, but for this month, we have through November 30th, Our revenues are $14,941,000 and expenditures $12,286,000 for the year. We are, again, for those of you that are new, the reason we have such a positive balance is that we get our annual appropriation from the county over 10 months instead of over 12 months. So we get it kind of front loaded. And that's largely because of that 2.7 million that you see right there, which is the local salary supplement that was paid in November to the employees. And as you look at the report, we're about 40% of the way through the year, and pretty much we're on track with that for all of those budget lines, with the exception of two. One is mine and Scott's. We are 75%-ish, and that's because we pay for things up front at the very beginning of the school year. The big thing is, like we were talking before, insurance. We pay that right up front. So we are front loaded on our expenditures in our program, and the 5,500 line, which is the co-curricular, is only at 10%, I believe, and that is because athletics did not happen on a normal schedule this year. So we have not yet paid our coaching supplements. So we haven't spent that money yet. But other than that, we are pretty much on track where we should be.
Looks good.
It does.
Are you still paying teachers before Christmas their supplement?
They get it Thanksgiving. don't
The
they?
supplement was paid in November,
November.
before Thanksgiving. Yes, ma'am.
They can Black Friday shop.
Yep. Absolutely.
I know, they can't go anywhere online.
Yes, and then they will also get paid before Christmas as well. We're in the process of getting ready to print checks this week for folks.
Questions? Thanks, sir.
All right, thank you much.
All right. Technology upgrades. Mr. Fender, haven't seen you in a while. Welcome.
Thank you. Thank you. Tickled to death to be here.
Yeah.
Given this late hour, I have decided to opt for a shorter introduction to this presentation rather than a longer one.
Sounds good.
In October, Chairman Craven asked me to investigate and to research some options for improving our audio-visual situation here. This has been built over years. It's been piecemeal together. It certainly doesn't provide the best of viewing for our remote, for those who are joining us remotely. Since then, Mr. McMurray here and I have reviewed 4 vendor proposals. We've visited 2 sites, one in South Carolina and the Buncombe County Central Office Boardroom, which we were very impressed with that setup. That being said, tonight I've asked Mr. Darrell Dutcher, who is online with us. I think he's still there remotely. He's an account executive at Troxel Communications, and Mr. Mason Harlan, a systems integrated with Western North Carolina Technologies, who is joining us here today. And now I'm going to ask him to come and share a very short presentation with you and give you an opportunity to ask any questions.
Thank you. Welcome.
I think Darrell may want to speak.
Can you
Go ahead, Darrell.
Hello, everybody. On behalf of Dr. Bryant, Mr. Fender, and Matthew, thank you for allowing us to attend tonight. School board members, been watching the entire, commend you on the operations of your school district, especially of the last budget. Were outstanding. Congratulations. In lieu of these hard times,
I guess that's why we need new systems.
Hence the reason why.
Did we lose Daryl? We just can't hear it.
I'm gonna go ahead. So
Yeah,
you can,
just somebody let Daryl know. We can't? We have no way to talk to him? Okay.
I want to thank everyone for the opportunity of having us here this evening to go over the upgrade of the boardroom AV equipment. I will make this short and sweet. I'm going to go from a 10,000 foot altitude, try not to get technical. So essentially we're looking at upgraded equipment here in the boardroom. On the first slide here, what I want to discuss briefly is upgrading of your current video system and cameras here in-house to a 4K system and a studio integration where you can have local video and also your live stream and multiple live streams simultaneously with recording of the sessions integrated and built in. Also in the proposal, we're looking at upgrading the projector to a rear projection. Currently, you have a 4:3 aspect ratio on the screen. I think everybody can tell. Well, we're going to eliminate the jumping on the screen also with this, so that it doesn't look like an earthquake on the video.
When the heat comes on.
Well, we would remove the projector from front view. It'll be mounted on a rear wall behind the screen. Everything will be projected forward. We'll also be switching to a 16:10 ratio so that you don't have the two black lines above and below your current image.
Mason has done a great job for us here. He was instrumental in upgrading the minitorium at Buncombe County Schools boardroom. So with that, just kind of give you an idea of who we are and what we can supply for you. And Mason, I'll turn it over to you if you want to go through the slides real quick.
Thanks,
Thank you, Daryl. Moving on the touch, we would also be including a touch panel control. And what this would allow you, instead of having to physically come in and lower the screen with a remote or a button somewhere and then turn the projector on and off, all of your setup, we will have a panel that would sit on the desk. It could be one button, someone walks in, hits the button, the screen comes down, projector turns on, all the speakers come live, the microphones are set, and then you can present wirelessly with a laptop. So we can make, the system will be very technical and also very simplistic if it needs to be.
Like Bluetooth enabled? Is that how the laptop connects to it?
We use a device that's called, give me 1 second, I'll get to the end and do questions and we'll run through it. But so touch panel control, your audio will be switched. Currently, you have mixers that are on each one of your microphones, so you have to manually adjust and control volume on devices that are being used, whether it be a laptop or a microphone. Let's say I talk a lot louder than someone else, then Matthew may have to go over and turn my volume down, and then someone comes up and they speak quieter. Well, you have what's called a DSP, and that's digital signal processing. So now everything's controlled electronically through software. There will be no more knobs or anything like that. We have compressor limiters where it actually puts everybody on the same level. Thank you for your time tonight, Troxel and WNC Technologies. And now I will take the proposal that we currently have in front for the upgrade of the boardroom is $74,864.64. And now I'll take any questions y'all have.
Mason, can you explain to them a little bit more, if you don't mind going into a little bit more detail about the cameras, the preset position, the picture-in-picture,
Okay, we have on the proposal, it's line itemed out on every piece of equipment that will be included. You're going to be going from one current camera that you have an overview shot of now to 3 high definition 4K cameras. 2 of the cameras will be located center to further back rear of the room, and then 1 will be front of the room so that you can pick up any guest speakers or presenters. And then on the touch panel, you will have the ability to PTZ on whomever is speaking. So let's say if in this case we're speaking, that you hit 1 button, the camera will automatically come over, go to that seat. Whoever else is speaking, it's as simple as just a 1 button push to move these cameras, where you're not going to have to do a joystick and see the camera moving back and forward. The TriCaster is a full production studio suite. So essentially what you will be upgrading to and what we're presenting is what all of your local television stations had 5 years ago. This is an upgrade to what they had 5 years ago. There was not a television station that will be running what is included in this package.
Mason, could you answer the question about the Bluetooth?
We have a device that's called Screen Beam. And what Screen Beam does is it uses either Miracast, which is now integrated for remote display within Windows. And it also uses Apple AirPlay. So any Apple device, tablet, laptop, Android, or iOS smartphone, you can walk in and you will be able to directly wirelessly present audio and video locally and then also live stream.
So I think one of the most important things, like I'm sitting here and I can look at the YouTube feed right now, is behind me is a big white blob that YouTube essentially sees. And so no one that watches us can see any of our slides that we have right now, which I think is important that they need to be able to see that, because I don't see this stopping anytime soon, us doing remote sessions. But would you, $75,000 is a lot of money to put into some cameras that are effectively almost like a car, going to depreciate as soon as you buy them. So is this a Cadillac system? Is this an economical system? Where does this fall in line with normal, one camera, web camera, and Matthew behind 3 monitors?
This I would consider
4 monitors, sorry.
on the level of a Lamborghini to a Volkswagen. This is a Cadillac. It falls. It's not your high end system. We've done boardrooms in excess of $200,000 for a boardroom upgrade. And again, I'm not a salesman. I'm an engineer, so I just put all the.
Yeah,
I
exactly.
like it even better. So how upgradable, I guess, are these systems? Because, over time, they're going to constantly, better cameras, 18,000K, and, everything's going to get better.
Right.
How can we upgrade individual parts? Do we have to buy the whole thing again? How does that work?
You'll be able to, depending on new tech, typically will. Let's look at Buncombe County. We just upgraded Buncombe County. Their system, we left the cameras in place that they had. We left the monitors and everything that was local in place. And what we upgraded was the actual new tech device, or the first slide that I showed, which is your control studio product.
Right.
And integrated that with everything that they currently had in their existing boardroom. The Crestron, the touch panel control, they have all of that. And all of that was still usable within the upgrade. And there were essentially two reasons that we upgraded the TriCaster in their situation. When it was originally installed, they had a component video, which is, they were running at 480, a resolution of 480i, I believe. I don't even think it was P, but they wanted to upgrade their HD resolution, and also they wanted the capability of doing an immediate multicast live stream. And the old TriCaster they had did not have that functionality.
What's a multicast?
With the new TriCasters, you'll be able to live stream 2 dual streams. So if you want to send it to YouTube, I believe is who you use now.
YouTube and Facebook.
You could send to Facebook simultaneously.
Okay.
Where's your company located?
We're located in Weaverville, Asheville.
John, are we planning on keeping the live stream going after COVID?
Oh, yeah.
Absolutely.
Yeah.
I think we recognize the value that it's presented, in terms of the ability to present. I know that the board probably would have individual perspectives on that. One thing that I think is helpful to understand when you talk about any consideration for upgrading this space is the way it can serve not just the board, but the entire school system. When you talk about being able to use any technology that could have clear live pictures for professional development, for support activities that are not just board meetings. We know at the height of the board meeting, we were over 4,000 views with, as Ms. Craven said, a screen that you can't see and circumstances you'd like to upgrade. But I think we've recognized the community has come to rely on us to be able to tune into this particular space in a way that can maximize their engagement in this case.
Is there any talk or is there anything about us getting a new central office down the road anytime?
No, ma'am, not that I could possibly imagine. I think the central office, we would want to make sure that every school and every school need were satisfied before we engage in any conversation.
Okay. And Mr. Fender, have we checked with any other companies? Four
other companies, yes, we could propose this. This is what we felt like we could.
With the same thing from other companies?
I know they all did propose the same exact.
They did or did not?
They did not.
Okay.
May I ask a question? Are these funds already set aside and allocated for this project?
No, ma'am. When the
Okay.
board began this discussion, it was a conversation around new need, which is essentially of the virtual world that we entered at that period of time. And so at the direction of the board, they asked us to explore what options are available. They are not included in the budget, and there's no dollars allocated to them.
Is this going to be financeable like Enterprise was doing? And we can have a return on investment too?
No.
Like, I can answer technical questions, but as far as the money and dollar figures, one quick interjection. But as you were saying with YouTube now, you have a rear camera. Your cameras are supposed to be used for what's called IMAG or image magnification, and that is just for the speakers or someone that's in the room. You never want to show the screen. So in the new system, you would never have a camera that would include that screen behind you because it gives you the bloom effect and you're running video back through the system. So you would be able to interject PowerPoint and resize and move onto the screen.
It's a picture in picture.
It's not through the camera. So your PowerPoint, you could have your live video and you could have, if you were video teleconferencing with someone, you could have that back here on the local screen injected, and then you can pull your PowerPoint up and set that inside of the live stream also, but it's not coming from a camera inside the room.
Gotcha.
You know, I know this isn't, hold on one second, Jay. I know this isn't like about our board meetings, but can you imagine how awesome it would be to be able to say to your child's grandparent who lives in California or whatever, hey, they're being, like we can have people here, they're being recognized for their band all-state performance or, you know, whatever, and tune in. And or a teacher like, hey, I'm nationally board certified, they're recognizing me tonight. You know, that would be just an amazing thing that we could offer our students and teachers and to the community.
What are we going to delete next year to get this?
Good question. Mr. Egoff?
Yes, I heard you mention about the white glare behind you. Did I didn't hear the answer to that. Is that going to be fixed?
So he said essentially it would be a picture in picture. You wouldn't actually even see the screen behind us anymore. It'd be more focused on the individual speakers, right?
Correct.
Slides or not?
Say that again?
But you would see the slides or not?
Yes, you would see the slides.
Because I'm sitting here, obviously, this whole meeting virtually like most of us have at a time or two, and it looks okay. The only thing I can't see is sometimes y'all are bringing something up on the screen that I'm looking around for in my notes and I can't find, and I can see how that might be something that somebody would want that's watching it, but otherwise the sound quality and the visual quality tells me enough. I mean, you're not watching a sporting event and you're not seeing if you got 2 feet in bounds. I mean, it's pretty good like it is, but you can't see the screen behind you at all.
Yeah, and you see just the back of Dr. Bryant's head.
That's okay. It's nice and shiny.
It's shiny, reflecting
So
places.
I think, Dr. Evers, where this started from is that as soon as we went virtual, we had 4,000 people that day. Just all of a sudden, we decided to start throwing this thing live. And today, as I was looking at it, we've had up to like 275 people watching today. And you've been in these meetings. At the end of a meeting, how many people do we actually have sitting here
Right.
2 years ago in these meetings? 2?
What's here?
Right? I mean, maybe. And I think it's really important that we have more buy-in from the community and more people that can watch this that are home with their kids or still in school, whatever the case may be. I think it's important that we be able to do that. I think $75,000 is a lot of money for some cameras, to be honest with you. I think is a way that I would like to see that we can do it a little bit cheaper than $75,000 for sure. Like maybe we need a Ford Focus, but
Yeah, I was gonna say like a Camry.
yeah, Camry's good. But are there options that you have that are cheaper or more affordable that would satisfy our needs?
Yeah.
Sure.
Correct. There are those options, but someone mentioned earlier, how do we save money? Being Troxel, we are plugged into many leasing factions and opportunities there if you would like to lease the system. We can do that. The reason why we selected this system for you is we're actually going to do the heavy lifting on this side. And the end result is that you get an easy system to operate. And the best part about it is you don't have something that's going to fail. With the newer systems that Mason has put together, this system eliminates quite a bit of racks and racks of equipment that you would back in the old days. And I would say this with a grain of salt, maybe 5 years ago, you would have to buy multiple racks of equipment. With the newer systems, everything is software generated. Everything is controlled over software. And that's where the expandability comes in. Someone mentioned earlier, can we expand on it? Absolutely. These systems are more robust. It's going to last longer. You can add more equipment to it. The other addition we did to the Minitron, we actually included a laser projector. With laser projectors alone, you don't have to pay for projector lamps. And some those of us that have been in the classroom spend most of your budget on a projector lamp. The projector that we're going to put in this system has no lamp. It uses a hybrid laser engine in it, and it comes with a 5-year warranty with 20,000 hours. So warranties are better. Your quality of equipment is better. All the way around, it's a significant improvement of what you have. We could probably scale it back, but would you suffer from performance? Is performance important to you? We think it is. We think that you want a good finished product with a turnkey solution that you don't have to manage. And with the multi-platform features that are built into it, that you can use any platform. You can use this with a Chromebook if you wanted to. You can use it with a Microsoft Surface or an iPad. All of these, as Mason mentioned earlier, you can use a telephone with it. This is the kind of flexibility that you would get with the boardroom, that anyone can come in and teach a class in your boardroom. Or you can have a guest speaker come in, and you don't have to scramble to try to get equipment to work with your equipment. Your system will already be set up to operate with it. So that's the takeaway I wanted y'all to know as to why we presented it this way. Less failure, more robust, upgradability is through the roof. And I guess Buncombe County not put a new tech mixer in their system, they wouldn't have had they would have had a harder time getting it upgraded. With the newer system that you all are getting is the same NewTek video mixing system. So with that said, highly recommend this system to you. The thing about getting competitive bids on systems is that everybody has a specific way that they will come about producing a system. Could you get an apples to apples systems? That's all based on the engineering and technology that company possesses. So it'll be very tough for you to get a same system bid for every little iota in your system. However, it can be done if you do a site visit and everything, but that doesn't always guarantee you're going to get the very same system. And we have leasing. We can lease the system to you if you like. We can definitely give you a quote on that if you'd like.
Yeah, let's go ahead and do that. Let's do some more homework on this. For me, 75 grand is too much money. We don't have it, right?
Maybe find somebody can just fix that, because like Jay's been watching it the whole time.
Yes.
What are we gonna need next year for kids? We don't know what next year holds.
Well, and it's about the same price as the referees. And,
It's true.
I would hate to say no to referees because of this.
Right.
no to sports, essentially.
Thank you guys very much. Let's keep working with Mr. Fender and let's see what those lease rates and let's see what we can pare this thing down considerably. And then we'll go from there.
Thank you all very much for your time
Thank
and
you.
allowing us to come in and present. We'll definitely put together another proposal for you.
All right. Thank you.
Thank you.
All
Thank
right.
you.
General Operations, Dr. Bryant.
Thank you, Mr. Craven. If I could start by just drawing your attention, there are a couple of dates there that just share with you what is upcoming, not just this month, but in the coming month in January as well. And then I'd like to share just a couple of pieces of information. First and foremost, I want to echo the chairman's comments at the very beginning of the meeting. Just before Thanksgiving, we dealt with a very, very difficult situation, and we dealt with it well because we have amazing community partners. The Hendersonville Police Department, the Henderson County Sheriff's Department, the Health Department, Emergency Services, those people, we cannot say thank you enough to knowing that we have people who are by our side when we need them. And so just on behalf of everybody in the school system, I want to say thank you as well to them being by our side. Steady hands, steady hearts, steady heads. And that is certainly a credit to this community. Also, I want to share some really awesome news that we learned just recently. Shanice Hill, who is a 6th grade math teacher at Apple Valley Middle School, is currently being recognized as one of the finalists for the North Carolina Center for the Advancement of Teaching, or NCAT, Beginning Teacher of the Year. Yeah. And so when we talk about the awesome people that serve, imagine being a beginning teacher right now. But we have one who is being recognized as a finalist for statewide beginning teacher of the year. And so congratulations to Shanice. That is a huge honor and recognition. And Ms. Case will quickly remind me she's also a product of Henderson County Public Schools. So we're especially proud of that. It's really cool. And then we have an amazing partnership that is going to take place later this week. We were able to connect through the great generosity of Biltmore Church, Flavor First Produce, and the Henderson County Education Foundation. We will be delivering and making available for pickup 1,100 boxed holiday meal kits. It's 20-pound box kit of fruits, vegetables, prepared meats, and otherwise. It will be available to families in our community. They'll be able to pick them up at any high school, middle school site in our community on Thursday afternoon. We'll also have 2 meals on the bus routes that are going to be going, and we'll be delivering some of those meals directly to parents and families in our community. So you'll see some information in the newspaper already. We've shared that. Press release went out earlier today, but that's a huge effort, again, that's happening in our community. Again, 1,100 meals being available for pickup and delivery through, again, a partnership and the generosity of Biltmore Church, Flavor First, and some work from the Education Foundation. So especially awesome.
And
So
is somebody sending out a thank you letter for that?
Oh, yes, ma'am. Absolutely. Hopefully we'll do about 1,100 thank you letters. That's going to be it's pretty awesome in that respect. And so with that, that's all I have from general operations, Mr. Craven, unless there are any questions for me.
That's it. I had one thing I forgot earlier, and I just wanted to congratulate Mr. Steve Sigmund on completing his national board certification as a band director out at North Henderson High School and a HHS grad. Congrats to you. So, without anything else, I will take a motion to adjourn.
If you don't mind, could I continue a tradition that Mr. Caldwell started?
Yes.
I think it's an important one.
Sure.
So if we're about to close, since I still have the gavel in front of me,
You got to hit it hard then.
I certainly would like to share that it is my great honor, and I am humbled to serve the students and the staff and the families of Henderson County. And I appreciate the opportunity to do so.
Absolutely. Thank you. And I'll take that motion now.
I move we adjourn.
Second.
Second.
All those in favor say aye.
Aye.
All right. We are adjourned.